things to say before we start. First of all, to welcome the visitors, the officers and the visitors from outside. And they are, for everyone's information, Susan Parsonage, Sally Watkins, Meriden Peachy from Public Health, Laura Callan, Jake Morrison from the CAB, Annette Meadowcraft from Wokingham Food Bank, Emma Cantrell from First Days, Simon Price, possibly Carol Camis, and John Halsall. So thank you very much indeed, all of you, for coming. Have I missed anybody? Callum, I can see you're there. Thank you for coming. Anybody else I've missed?
Chair, that's Annette Medhurst from Wokingham Food Bank.
That's brilliant. Okay. The minutes of, apologies for absence first. As far as I know, there are none, but Rachel Dubay is going to be a little bit late, about half an hour late, because she's attending the Fire Authority Management Committee. So,
Madam Chairman,
yes.
I'm sorry to interrupt you. Can I just say that I am a trustee of the Citizens Advice Bureau?
Yes, I was just about to come to that. So, are there any more apologies, Neil?
No, Chairman.
Right, okay then, so declarations of interest, and as Emma's just implied, if you've got any involvement at all in the community response to the pandemic, could you declare an interest? We've had Emma's. Anybody else? Andy?
Hi, Chair. I'm a regular volunteer at Wokingham Food Bank, and I helped out at the club in Norwich Church, which was a part of the community response. I think that's it.
Lovely. Yeah. Thank you very much. I've got Guy Granderson.
Yes, Chair. Just to declare that during the pandemic and afterwards, I have been involved in the manufacturing of PPE masks to give away to charities, organisations and the NHS.
Lovely. Thank you very much. Sarah Kerr.
Not sure if it's relevant to this meeting, but volunteered at Community Hub during the pandemic, the initial outbreak.
As well to declare it. Andrew Mickelberg.
Same as Sarah, I was a volunteer during the Community Hub.
Lovely. And Ken Meyer? No, it's not your hand up. Anybody else got their hand up that I haven't called?
Yeah, I have. Paul Fishwick.
Okay.
Yeah, my first one is my wife was a volunteer at the Community Hub. And the second one, I need to also declare an interest as I received a business grant as director of a small business. But understand I do not need to withdraw from this meeting, as the agenda items for the discussion are about past performance and not awarding new grants.
Yep, that's fine. Thank you. Simon Price.
Hello, Chair. I also do some work with Wokingham United Charities. I sit on the Arms House Trustees Board for West End. So just to give you that.
Thank you. Alison.
Like Sarah and Andrew, I volunteered at the Community Hub.
Yeah.
Just a foot soldier, though, not leading the team as Sarah was doing.
Can't believe that. Now I've still got hands up from Andy and Emma. Yeah.
Sorry, Chair. I forgot two others. My mother's a volunteer at the Citizens Advice, and I'm also the treasurer at the Woodley Lunch Bunch, which is a poverty reduction charity.
Sure. Thank you very much. And Emma?
Yeah, I'm sorry, Madam Chairman. I too volunteered at the Hub.
Lovely. Thank you. And Jim Fruin?
I was volunteering to supply food for the maternity unit in Royal Berks Hospital during all of this. I don't know if that counts or not.
Brilliant. Is there anybody else? Emma and Jim, you've still got your hands up. Can I say at the end of the meeting, I'm going to be asked by you to write a letter of thanks to the staff, but hearing all of you and what you're doing, I'd like from the chair to thank all of you, because I know those efforts have been going on for many, many months, very consistently, and it's absolutely brilliant to hear it all. Thank you for all that you're doing as well. Right, I'm going to take each of the items separately. There are no public questions or member questions, so we'll move straight on to item 44.
Could you just do the minutes first, Chairman?
Oh, sorry. Oh, I beg your pardon. Thank you. Yes, minutes of the last meeting. Any comments? Sarah?
Yeah, I just wanted to ask about the Traveller Transient Site business case and where we are with that, and the members' training on this. I just want to know where we are, please. Simon's here, so I'm wondering if he's got that info.
Neil, do you have any light shed on that?
I can shed some light, yes, Chairman. So the member training's been deferred until early next year because of difficulties around arranging it through COVID. The business case, if and when it is developed, it will come to scrutiny, so we've got that reassurance. And the final 2 points about updates on the website, I understand they've been actioned.
Okay. So just very quickly, on the business case there for a more permanent transient site, you said if and when. So there's still a question around if.
I think it's more of a question of when, Neil. Do you know when?
Well, that's my information. When it is produced, it will come to scrutiny in draft.
Okay. Just wanted to, check on that word if you use there. Thank you.
Right. Any other matters arising? In which case, can I have a proposer that we accept those minutes as a correct record?
Happy to propose.
I can second that as well.
Thank you. That's Guy, isn't it? Or was it Ken?
I proposed Ken.
It was Ken. And is there a seconder, please?
Guy seconded.
Thank you very much. That's Abdul. Yeah. Thank you very much indeed. Right, then let's come to the main part of the agenda. As I was saying, I'm going to take each item separately, and unless she wants to chip in on the others as well, which is fine, I'm going to ask Meriden if she could be mostly involved with the item on the scrutiny response. That's the last of the three, because we're in a very fluid situation at the moment, and it's ever changing. And we may have some questions to her about the current wave that seems to be coming our way and what we might need to do and how we might need to monitor it. So, Meriden, you're very welcome to chip in on the first item, but I shall be asking you some questions on the last one. That's okay.
Yes, that's fine.
Okay, thank you. Yeah. Now, first item 44 then, the corporate recovery. The report really is a sort of midpoint review. And first of all, I'll ask Susan and Sally and Meriden if she wants to say something, to say a very brief few words, and I do mean brief because we have all read all of the documents. And then really the main purpose of this meeting is for us to ask questions and to make any comments and proposals. So when we've had a brief report from the officers, just to let you know, I'm going to take questions first, and I'll take them in alphabetical order. And then when you've exhausted all of the questions you want, then I'll ask and proposals, because I think it'll be more clear that way as to what's happening and not get us into such a fix as to be asking questions and making comments at the same time. So if you don't mind, that's how I'd like to play it this evening. Right, Susan, over to you.
Thank you, Chair. I think what I will actually do is I'll hand over to Sally, because Sally's completed a comprehensive report on this in terms of where we are with recovery. So I think that might be the best plan here.
Sure. Thanks, okay then, Sally.
Hi all. So obviously you've got our report in relation to recovery, and I just wanted to do just a brief summary, which is focused on the fact that from a recovery perspective, this is part of a standard approach to emergency management. We started recovery, really started planning it in April with ECLT, so the extended leadership team, and then the group itself was formed in May. That group was operating at the same time as our response was operating, which again is normal practice. It was comprised of the 10 work streams that are identified in the document, and the majority of those work streams were led by members of ECLT. And a really kind of core part of that recovery programme and remains part of the recovery to date is making sure that we've sought the feedback from the community and the partners that we work with during response, so we get that real kind of full holistic view of the impact both on the borough but also in the ways that we've worked differently with partners to be able to build on some of that different ways of working in the future. Recovery is still ongoing at the moment. I guess my overarching comment on that at the moment would be that we are obviously balancing recovery at the same time as that we're starting to get the rising tide for response. And what we're doing as part of that recovery governance structure is making sure that we are cognizant of what is happening corporately so that we can be agile in our approach to make sure we've got the right focus at the right time on the right things.
Lovely, that's beautifully brief. Thank you very much indeed.
Yeah.
Okay, I'll open it up now then to questions. Well, I've first of all got Abdul.
Sorry, Chairman, I think I've got my hand up from previously.
Oh, okay, not to worry then. Paul? Paul, are you with us?
Hopefully I'm with you now. Thank you, Pauline, and thank you, Sally, for the introduction. On page 17, it talks about the communications around the new QR codes, which were made available to hospitality leisure. Why was the press release on the QR codes that is mandatory from the 24th of September? Why did it come out so late on the 5th of October, 12 days late?
From, do you mean the QR codes that support test and trace?
It was the press release which came out from Woking Borough alerting everybody, came out on the 5th of October. Do you know why that came out so late?
Is that part of test and trace? Sorry, Paul.
Yes, it is. Yes, it's the test and trace QR codes.
Okay, so I mean, from a response, from a recovery perspective, that will be kind of looking at how the borough makes sure that we understand, I guess, the impact on how the council performed for the borough. From a QR code perspective, that's part of the, I guess, the response piece. What I'd need to do is check when we got the initial comms, but my recollection is that it was actually quite quick from initial insight into being able to do this through to the press release going out, but I'd have to go back and double check.
Okay.
Paul,
thank you for that. Yeah.
Paul, just you said that the press release came out on what, the 2nd of October? Did you say
5th of October?
5th of October, because I just went back and looked at that on page 17 because it's actually was the press release, because I recall seeing it. I can't remember the details, but was it associated with the local case tracing that was set up and ready from the 13th?
No, it was related to the QR codes and what needs to be displayed in hospitality, leisure places, that sort of area, which was mandatory from the 24th of September, but it came out 12 days late.
Yeah, because I thought I can remember the press release, I just can't remember the detail, as in regard of if I was referring to our local one instead. That's what I took it as. So maybe I'm misreading the press release.
Yeah. I've got another question, if that's okay. On page 22, the case tracing. The service was launched on 13th of October. How is that being staffed by Woking Borough? Are there enough resources available to cope with the increased cases, which we're now starting to see? And what's the capacity level for that?
So, yes, you're right. We launched it locally. So we were the first, and Meriden will, I'm sure, correct me if I'm wrong, but we were the first borough in Berkshire to volunteer to do that. So aside from Slough, obviously, who needed to introduce it. So it's been launched. So we started actually to know that we might need additional resources to support local case tracing in July. But at that point in time, it wasn't totally clear what those resources would actually be needed for. So what we did anyway is make sure that we started to go out to the business to ask for volunteers. So we've done an internal recruitment campaign, and a number of people stepped forward to say they'd like to be involved in that process. And we were supported through our HR piece to make sure that we had the right people. So the way we've done that is we've worked with those managers of those individual members of staff, and we've built what we would term squads, so that we've got the right level of resource to be able to deal with the modelling that we've done in relation to cases. So now that we're actively taking those cases through from NHS Test and Trace, we've got the modelling for the numbers that we're receiving at the moment. We've got the modelling for resources that I need at 50 cases a day, at 100 cases a day, and we've done that right up to 400. And what we've done is we've trained a number of staff that could be stood up as that resource is needed. So we're relatively comfortable and confident that should cases escalate quite quickly, that we can redeploy those people to support that kind of service for the council.
So if it just on a supplementary to that then, so if you're redeploying staff, what services are then not being done because of that?
So that's part of our assessment about how we approach, I think, response in totality. So part of our second wave planning approach is making sure that we've got an understanding of what elements of services from a council perspective can be paused, potentially to make sure we've got those kind of resource needs kind of mapped and understood. It's a bit like having the traffic light system for tiers. You can have the same approach for what services would be impacted. But at the moment, we're very keen to make sure that we're taking advantage of the government's Kickstart scheme to bring resources into the council where possible. And we're also making sure that impact on services to local residents are reduced where we can.
Okay, thank you very much.
You're welcome, thank you.
I've got the following people with their hands up, and I'll take them in alphabetical order. That's Jim Fruing, Guy Granderson, Emma Hobbs, Sarah Kerr, and Andrew Mickelberg. So first of all, Paul. Sorry, Jim. Not Paul. Jim.
I think you're on mute, Jim.
Microphone, Jim.
Hello? All right, Jim, can you speak? We can't hear you. Your microphone is off, Jim. Your mic is off.
I think he's realised, Chair, and is having trouble taking his microphone off.
Yes. Let me go to Guy, and then we'll come back to Jim when he's sorted himself out.
Paul actually asked my questions, so skip me for the time being.
Oh, super. Right then. Emma.
Thank you, Madam Chairman. I just want to say this is a very, very good explicit report, and I want to just say thank you, Sally, to you and your team. You haven't got an easy job, but I found it very easy to read, and I think it answered a lot of my questions. So thank you.
Thank you very much.
So, sorry, Chair, my technology's now caught up.
Sorry, are you with us now, Jim?
Yeah, I couldn't unmute for some reason, which makes a change. Sally, I found it a little difficult with some of the language in the recovery plan, including the word recovery, when we're not actually over anything yet. I'm sure if it goes out as a public document, some of the residents will find exactly the same. So, but having said that, I think the stuff and the content in it is very good. So thank you for that. I've got a couple of questions, if I may. On page 16, we talk about a midpoint review. Can I ask who, where, and when, and what that was, and how that has taken place? And secondly, I'd just like, I know we've only kick-started the test and trace on the 13th of October, But have you got any updated information on like the statistics, the stats, the numbers, how we're actually going? Is it working well? And is there anything else we need to do to try to help you with that?
Okay, thank you. That's no problem. So I think you're right. The terminology around recovery is confusing for all of us, and I think certainly during the period when we started the programme, there was a lot of conversation about whether it's recovery or kind of renewal. And I think my observation would be that kind of terminology, recovery, is part of the national emergency planning response, because normally it's used when you've got a major incident that has an end date and therefore you move into recovery. But because we're dealing with a pandemic like we haven't had before, it's difficult for us to kind of, change the terminology. But I think there is a good point to think about how we could land this better for people who aren't actually part of the process. So thank you for that. Take that one away.
Yep, that would be useful. Thank you, Sally.
Sarah?
Well, there's a second question, Chair.
Sorry.
Oh, okay. Sorry, Sarah. Come back to you in a sec. Jim, go on.
Is it the midpoint review? So the midpoint review from an approach is something that we would use in programme management as a standard. So the way that we approached it is when you start a programme that is multifaceted in its outcomes, what we tend to do on big kind of multi-complex programmes is we would undertake a midpoint review to make sure that the objectives that we're trying to reach through the delivery of that programme are still valid, because obviously we're subject to change. So that midpoint review really is like a health check. The way that we undertook it was I engaged, so I'm part of the Berkshire Recovery Group. So we started to look at how Berkshire at a county level had approached recovery. We took our work streams and those work streams and did a gap analysis to understand if there's anything that we could change or refine or improve. We sought feedback from all of the AD representatives at Corporate Recovery, and part of that is actually changed. Got an impact on how we would approach recovery moving forward. So we're going to streamline some of those work streams so that we don't have unknown interdependencies, and also that we've got better alignment with the Berkshire approach.
And the reason I asked, Sally, is it's such a moving feast.
Yeah.
Moving beast that I just didn't understand how you could do a midpoint review, because everything just keeps moving around all the time.
Yeah, and we have tried to respond to that by making sure that we've got those connectivity sessions for ADs. So we bring them together every week on like an optional interdependency session, and then every fortnight on a more formal reporting footing. And then out of the back of that comes a report that goes up through to CLT, which is presented by Graham up to Susan and colleagues.
All right, thank you, Sally.
Thank you, Jim. Sarah.
My turn now.
Yes.
Cool. All right. Thank you. I wanted to firstly ask about the resident survey that was done. What was the intention of the survey? Was it to find out how people were feeling about the council's response, or was it to actually find out about residents' feelings about the whole situation, or was it a combination of the two?
It was, if I'm honest, Sarah, it was a combination of the two. So what we did is through the Berkshire Recovery piece, again, we were able to understand how other local authorities had approached it, both within Berkshire and out nationally. And the feedback was some local authorities dashed immediately to a 50-page questionnaire out to their residents, really in the middle of recovery. And what the feedback was that if we had a much more targeted piece that was based on hypotheses that we had in the council and through that we'd gathered through working with partners, that the information that we would gather from residents would be much more targeted to make sure that we got the right information to support residents moving forwards. We also wanted to really get an understanding about the impact that the unseen impact potentially that COVID was having on residents within the borough, and also what they felt were important to them moving forwards. And part of that is making sure that their voices, their perception, and what they were looking to do longer term is captured in a way that makes sure that we feed that into both the recovery plans where appropriate, but also into how we shape service delivery moving forwards. So for me, obviously, with my IT hat on, getting the feedback about digital services and take up and how that operates will inform my digital strategy moving forward.
Okay, so when it says under the resident survey outcomes, the resident survey received a positive response with a good return rate, do you mean the positive response in the number of returns or the positive response in terms of the content of the responses?
So both. So I mean, from a take-up perspective, we were just shy of 1,500. So you know, we were pretty pleased with that take-up. And actually, there were some really positive insights in there from residents who said that their satisfaction with the council had increased from where it was pre-COVID to where it was when we did the survey between July and August.
Okay, that's why I asked the question about intention, because obviously I see that the satisfaction with the council has increased, which the council sees as positive, obviously. But then some of the top areas that people highlighted as being issues, and obviously connecting with family, friends, community, stress and anxiety, diet, eating disorders, and all of that, I wouldn't class those as positive. They're obviously challenges. So I was trying to understand where this was coming from, because obviously some real challenges have been highlighted, and I think as we progress through this, I know we're talking about recovery, but we're also still dealing with the ongoing issue. Yeah. Are there any plans to do further resident surveys on this? Because I'm particularly conscious, and obviously I don't speak for everyone, but people that I speak with, I know that there are huge issues. There have always been huge issues with mental health, but we've actually reached a tipping point, I think, where it's actually getting much worse. And I wonder how people's feelings now are compared to where they were to the initial survey. So are there plans to do more outreach to understand the impact as we continue through this process?
So I think that's a really good point, and there is that piece around for us being able to understand how our residents feel, both positive and negative, is really important to us, because if there is a rise in mental health concerns, which it has definitely come out loud and clear in the survey, we can take that information to be able to shape our offers, I guess, our response to that. I don't have any date currently planned for a secondary survey, but it doesn't mean that if the general view is that we're getting some good feedback that we shouldn't do it. And also, I think to support that resident survey, we did a number of workshops with the voluntary sector in town and parish as well, so we could actually get that kind of breadth and depth of feedback, both from how we've worked with the community but also how we've worked with our partners. And I'd like to do those too.
And I think actually as we look more to a more varied demographic, I know from the responses it says that it was predominantly female participation, and obviously different people will feel different things. So seeing that going out much broader to really fully truly understand the impact. I did note on page 17 of the report, when we're talking about mental health, it talks about having documentation around mental health and wellbeing produced and made available online. While that is helpful, those that do suffer with mental health issues, different people will access things in different ways. From personal experience, I wouldn't go to a website for mental health support. And I know that it's so difficult to get anything other than COVID and flu related care from the NHS at the moment, people being turned away for other things as well. I'm really concerned about this. Now, this may be a bit of a big one for tonight, but I think there is plans for this to go to one of the other scrutiny committees, but really understanding how we are going to be long-term tackling this mental health issue. And sorry, I'll let you finish and I'll make another point quickly after.
Let's have a go. So I know that I don't have the detail, but I know that there's activity underway that's being led through Matt Pope's directorate. So Adult Social Care are looking at how we support mental health at the kind of lower level 1 and level 2, rather than just kind of that kind of critical mental health intervention. So it's possibly worth kind of getting an understanding about what that approach is moving forwards. But I do know that it's high on the agenda in adult social care.
Okay, thank you. And just a point and one last question. The point is, obviously, this is obviously about recovery while obviously managing the situation. There are still a lot of things that haven't been addressed in this report from a recovery perspective, and maybe this is something we can discuss in future programming. For example, green recovery, that side of things. It's not so. While there's some good information in this report, there's still a lot that's not there. For us to understand the full picture. So there's quite a few gaps in what we've had tonight that I would like to see addressed in future meetings. The question, though, is it goes on to the staff that we have. You know, how are we as an authority going to deal with the longevity of this situation? I'm certainly feeling fatigued. The staff must be feeling fatigued. Obviously, we didn't know initially how long this was going to last. We had a little bit of time in the summer, and we're now going back into a second wave. How are we going to deal with the staffing levels and looking after our staff?
I think that's a challenge nationally across local authorities up and down the country. I don't think there's a one perfect answer for it at the moment. What we have been doing is making sure that we understand how our staff are feeling. So from as a member of staff, and obviously I've taken part in it, but being able to have things like the big chat where actually they've got access. So now we've got members of CLT and Susan obviously hosting big chats with staff. I know that John has taken part as well, where actually people from up and down the organisation are able to have a platform where they can ask questions directly, raise concerns. We've also done a lot of work around how we can support staff who are working remotely. So there's been loads of learning for us as leaders as well about how we do welfare checks on our staff when we actually aren't in the office. And we're also doing things about how do we continue to learn and adapt to this kind of different way of working longer term, which again I think is a national issue. I don't think I have a distinct answer about how we're going to manage this longevity of COVID right now, and I think that is absolutely something that we're starting to work up through with through CLT.
Okay, Sarah.
I think Susan might want to come in on this.
Yeah. Oh, yes. Sorry, Susan. Yeah.
Just to really add to what Sally has said, I think that actually the well-being of staff obviously in this is really important, and it was something that was discussed at the Solace conference last week, which is for all sort of like senior officers across the country, and what was talked about is how we should bring, managing digitally and that social awareness, being really aware of actually observing people that you're managing. So really looking out for signs that you wouldn't necessarily be ordinarily looking out for. So it's a very nuanced way of actually managing, and so it's something I think that we'll do a lot more work on it, and it's something which is being faced right across the country, and it's absolutely mental health and well-being in all of this is going to be critical, and ensuring that that staff are supported in the way that they need to be supported. But I guess I want to say, it's absolutely high on the agenda.
Okay, Sarah.
Thank you very much.
Thank you very much. And now, Andrew.
So can I just say, Jim, could you put your microphone on mute, please?
I'd love to be able to do it, but if I switch it off, I can't switch it on, and I now can't switch it off.
Okay, it's just there's a lot of noise coming in. It's distorting the sound.
Well, we'll have to cope because I know IT is not infallible.
Yeah. Okay, thank you, Chair, and thank you, Sally. I'd like to ask 4 questions, please, in 2 tranches, if I may. Firstly, there's a lot of references in the report to corporate recovery. How's WBC dealing with the heterogeneity of local businesses? Is there any form of triage system of prioritisation? What potential avenues still exist for trying to connect with those businesses that continue to be hardest to reach, or who haven't been on the radar, the council's radar, in the first wave? And the second question, you've made some references tonight and in the report to the Berkshire Recovery Group. Could you briefly explain exactly what the relationship is between WBC Recovery and the Berkshire Recovery Group? You outlined a couple of the ways in which you are using that relationship productively. Are there any other opportunities that might exist as being part of this Berkshire Group, and indeed how might this be strengthened further?
Thank you. So if I take the Berkshire one first, so the Berkshire Recovery Group was initiated through the Berkshire Chief Execs Group. So it's like a sub section of that arrangement. And what it is really from our perspective is to be able to identify priorities and opportunities where we could work together and learn from each other. So that really is the main driver for the Berkshire Recovery Group, because as local authorities, we tend to be facing some of the same challenges. And a key element of that Berkshire Recovery Group we've been kind of created those into work streams. So we've got, how do we approach direct hardship? How do we approach children and young people, health? And for me, I'm leading on a work stream across at the county level that's focused on transformation and resilience. So what I'm doing from that perspective is I'm bringing my opposite numbers together from across different local authorities. We are looking at our digital strategies and our customer strategies to see where we've got synergies and opportunities to be able to work together. And I guess a key part for us is understanding how that local way of working can actually support us longer term. But it is very much something that is focused to support the county level response. But what it doesn't do is dilute from that localism piece that we need to do for Wokingham. It's very much a learning platform.
Okay, Andrew, settle.
Yeah, and there was the question also about the heterogeneity amongst local businesses. So one of the things we did for local businesses through COVID is make sure that we didn't just wait for businesses to contact us in relation to support and business grants, where we did a huge piece of work that was led through adult social care in relation to welfare checks. We took that approach and then extrapolated that for our businesses. So where we didn't, if we hadn't received response to our emails or our contact that we put out, then we introduced that welfare check where we were actively seeking contact to try and get those businesses to engage. Also, there's been a huge amount of learning that we're doing through our work with the LEP, and also being able to, there are business groups that are set up through the council that will continue to try and build those relationships and, like you say, reach those hard to reach businesses that might not traditionally contact local authorities.
Okay.
Thank you.
Susan, did you want to come in on this? Because your hand's up.
Oh, no, sorry, I need to take my hand down. Sorry about that.
That's okay. Andrew, have you finished your questions?
No, I had two other questions, if I may.
Okay,
on page 19, we're told that the local case tracing was ready to launch on the 13th of October, and that this deals with cases not contacted by NHS Test and Trace. What resources are available to support this? Is this being staffed, for example, by WBC employees who are being redeployed? Is current staffing sufficient to cope, including with the likelihood of need for some flexing up? And I'd like also to ask a question also about the residents survey. The response highlights mental emotional health. Is there any, and I do appreciate that the survey was undertaken in July and August, but even at that stage, was there any evidence in the responses of any cumulative impact of COVID on mental health? In other words, are we finding not just an increase in numbers, but also complexity, of mental health issues? And if so, are we are we able, to gear up to deal with this?
So if I take the test and trace one, if I may. So as part of that setup to launch the case tracing service, we identified staff in July. So as per the previous question, we knew that we might need additional resource, but it was making sure that we had those people kind of ready on the bench. And what we did was a training programme that started to brief people who may not have been as close to recovery or response from the council to really explain what we were doing, what we knew at that point. And then what we did was build a training approach through the support of public health to really make sure that those volunteers that we recruited during July were as prepared as possible to launch the case tracing in October. And I'm sure Meriden, because I'm just seeing your hand come up, Meriden, will hopefully reiterate, I think Wokinham's preparedness and readiness at that level was the reason why we were recommended to go first, because we'd done all of that preparation prior and much sooner than the other local authorities in Berkshire. The resource is flexible, so we've done it in a way where we can draw down on resource from different areas of the council at different times. So that what that allows is that we aren't putting like a real concentrated pressure on a particular service. We are running a rota basis, and I've got members of my team who used to work in customer services, so we're used to being able to rota resources on, which means we can take a small amount of resource from a particular area and have it operating on a couple of hours basis, rather than saying that I need to take people full time. That squad is relatively big, again, much bigger than other local authorities have got ready, and we're able to stand that resource up as needed and flex that resource depending on the level of infection rate for the borough.
Okay, Meriden, do you want to come in on that?
Yes, I was just going to comment on the resources for test and trace. And all councils were given some resources for outbreak control planning. And as the request of Tessa Linfield, all 6 councils put some of their money into a central pot for Berkshire. And with that, we employed some health protection specialists and some coordinators. And actually those specialists have been quite critical in working between Public Health England and the councils to get contact tracing up off the ground. And Public Health England were over the moon, actually, that we actually gave so much support to it. And it's the first time in the country that 5 councils have been done all at the same time. And it was much more cost efficient for Public Health England. Most councils takes 2 to 3 weeks for each one. Well, we've done 5 councils within a month. And so some of that resource went to a Berkshire pot, which has supported the council. But the council has also put in quite a bit of its own resources in terms of people. And one of the reasons why Wokingham was so quick is Wokingham had already made a commitment they wanted to do it. They'd already agreed, they'd already identified the people, and was probably the quickest in the country actually getting it set up.
Thank you. That's helpful, Meriden. Thanks for that. Now I've got Andy Croy and Rochelle, and welcome, Rochelle. Thank you for joining us back from the Fire Authority. So Andy first.
Thank you, Chair, and thank you, Sally, for the presentations. A lot of the presentation is concerned with outbreak management. My understanding of an outbreak is where you've got 2 or more cases in one area. But I also understand that most of the transmission that we're seeing in the borough is transmission within the community. And so that was perhaps less covered by the policies or the things that are described here, with the exception of the case tracing, which will cover that. And sorry, my phone's just gone off. My question then is the way the infection rate is going at the moment, we're going to hit about 100,000, about 100 infections per 100,000 by the end of October. Now that's the level at which a local authority would normally be moved from Tier 1 into Tier 2. We're going to go to Tier 2. And we've seen nationally reported that once authorities get to Tier 3, they don't really come out. There does seem to be an inexorable upward progression. So given that we will be in tier 2 by the beginning of November at the latest, how confident are we that the measures we've got in place for tier 2 will stop us going to tier 3?
I think that's potentially a question for, I guess, better fielded than by Meriden.
Yes, I appreciate that.
Yep. That's fine. Go ahead, Meriden.
Yes, I'm very happy to help on that one. Your assessment is correct. The rates in Wokingham are still going up. As a matter of fact, I think today the weekly rate is up to 77, and it was 60 something last week. So it is going up. If it continues at the rate of the southeast, which is around 6% a week, we could well be in the 100,000 by the end of October. And yes, that is one of the indicators to move to tier 2. All the way through the pandemic, Wokingham has not been in the highest category. In terms of being confident that we won't get to tier 3, there's a number of things. One is, how good are we at managing outbreaks? And I would say across the board, we're very good at managing outbreaks. But over 70% of the cases at the moment, we don't know the source. They're not as a result of outbreaks. So it'll partly depend on how good we are at getting the informal intelligence to find out where these sources are, which will be our next challenge. So I can be reasonably certain that we're very good at managing outbreaks, and we don't wait till there's outbreaks. When there's one case, we're in contact with the private sector, the school, the care home, and we're managing every case because we've got one access point for the council. So outbreaks are managed well. We don't necessarily have all the intelligence of where the transmission is coming from. Reading University plays a part in that. We know that students aren't necessarily complying the same as perhaps those over 60. One good thing in our favour at the moment is our numbers are mostly young people. We don't have significant numbers over 60, and that's when you start getting critical impact on the NHS. If you have a lot of cases over 60, they're the ones more likely to be using healthcare services. So I can give some reasonable confidence, and if we keep going with all the things that we're doing, I'm hopeful that we shouldn't reach tier 3.
Okay, thank you. John Horsell, do you want to come in on this, and then Susan, while we're on this topic?
I do. It's a question of management, and it's a question of all of us. I've written to the councillors, including you, just an hour ago or half an hour ago, to encourage you to be champions and evangelists for the cause. We know that the virus is transmitted by social contact, so ergo, if people don't have social contact or minimize their social contact, the virus will be transmitted less. So we need to mobilize the whole borough to change their behavior. It's not certain that this virus will ever find a vaccine. It's not certain that we will ever come out of the current situation. And so the only option for us is to change our behavior, and that's to change the behavior around 180,000 people. I spoke to the schools forum today, and I cited the example of 2 examples. One was my little boy who, when I was a smoker, came back from school and said, "My teacher says that only stupid people smoke." And I then was faced with the answer that either I called her teacher stupid, his teacher stupid, or so that I'm stupid. And I did the other thing, which was give up smoking, and I haven't smoked since. We've changed the behavior enormously in this country. People don't drink and drive. My 3 children wouldn't even think of drinking and driving. So we've got to make the same sort of behavioural change. but we need to make it quickly. We need to mobilise everybody in the borough to be evangelists for the cause. If we can do so, then the curve will go back downwards. All the staff at Woking Borough Council have put into the safeguards which professionally they can do. Our GPs are second to none. The CCG is working with us. The hospital is working with us. And so we need to be a beacon of light in a country where everybody is assuming that there's an inevitability about it. And that applies to you, that applies to Andrew. I've asked you in the past to not occupy officers' time with frivolities. And this is a time when we really have to pull together and to make sure that we've changed the hearts and minds of the whole borough. And that's going to be difficult to do. But if we can do that, we can learn to live with the virus. So that's, I think, all I have to say.
Thank you, John. Thank you very much. Susan.
Thank you, Chair. What I wanted to focus on is that I had a conversation with CLT and ECLT members yesterday. It was a meeting about how we can focus more around the community transmission and some of the behavioural stuff that John has just spoken about and other actions that we can take. So I started with the premise of that Meriden has mentioned, in that the age groups that we need to focus on are 18 to 34 and 35 to 64. That's another sort of like growing age group. And we've got a broadly compliant population, and we need to focus on non-compliance. So that was sort of one premise that I started with. And at the same time, I think we need to get much better at the intelligence and data that we have to inform the actions that we need to take. So, for example, Sally's talked about Trace. And what we need to do is to really push Trace as far as we can in terms of whether that's knocking on doors and really understanding the different contacts and where those individuals have been that have tested positive for COVID. At the same time, we need to get to a granular intelligence on the community transmission, and that's the data from Public Health England. And Meriden and I have had a conversation about that. We need to also understand any of the an overlay information that comes from the police, for example, about what the police are getting in terms of intelligence, and then what's going through our PPP in terms of businesses where our residents are reporting about businesses. So, for example, last night I saw on Twitter one of our residents talking about a bar that they'd been in this borough, where social distancing was not placed, and I was in contact with them, and they were also going to report to the PPP about this particular bar. So I know that what we've got to do is obviously change the behaviour about what's actually taking place in places like bars, so that I know that that's sort of being taken forward. So it's about us being alert to where the right behaviours are not happening, as John has spoken about. And for me, it's about actually having a great wealth of intelligence, overlaying it so that we can really target our actions. So that's just to give you an idea as to what I've been doing as well with CLT. But absolutely, it relates to what John was talking about in terms of we need to be alert to ensure that we identify where the non-compliance is actually happening and then seek to change that.
Thank you, Susan. John, did you want to come back? Your hand's still up.
Yes, please.
Yeah.
I'd like to add to what Susan said. We have a team in our office, second to none. They are prepared to do almost anything that we're asking them to. We have an envelope where we employ a certain number of people, and the undertaking that I've given the certain number of people is that our policies will be directed to not making any redundancies, but also not taking on people to fill in gaps. So apart from using the full advantage of the Kickstart scheme, the apprentice scheme and such like, the response has been absolutely amazing. The first wave was prepared to be flexible, and we're hoping then for the same flexibility. If we could go from lockdown to lockdown, as is being proposed elsewhere, we will kill all our businesses. The small businesses like pubs and hairdressers and nail bars and whatever will be dead. They will not suffer. They will not survive into the totality another shutdown. So we need to be more intelligent about it, and the more intelligent approach is behavioural change. So as a borough council, we're locking down the care homes as much as we can, which is fantastic, because we really don't have a problem, given the work that Matt Pope and his team did in the first wave. We don't really have a problem in care homes. The schools have been absolutely fantastic. They've got the schools going up and running, and they're very positive about also being part of the evangelism of behavioural change. So we now need to get you as the councillors to recruit it to this, and the parish councillors and all other community workers, so they change the curve. It's not difficult. This virus is transmitted by social contact. And if we can get the message through that the social contact must be minimized, whatever, then we will change the game. And that's what we must do. All of us, 53 councillors, must work our socks off to change the behaviour of the community at large, so that we can reverse the curve. And it's not inevitable. We can beat it. And I ask you for your support tonight.
Thanks, John. Rochelle, and then I'll come back to Andy.
Okay. You were talking about test and trace, and you've also shared some money. How much test and tracing are we sharing with the other boroughs? And considering that both Slough and the Royal Borough are expected to go into Tier 2 by the end of this week, and Reading is likely to go into Tier 2 probably next week, according to most of the predictions at this point, how are we going to be able to test and trace on local residents going out of the borough, because sometimes they don't always stay in the borough?
From a local perspective in relation to resourcing, so Wokingham has set up its own local case tracing service. We do get supported by PPP through our partnership, and they will download the data for us over a weekend. But from a resource perspective, we are sufficiently resourced within Wokingham, and should we need to have additional resources over a weekend, although I don't think that's required at the moment, we have got the right backup in place.
Okay, what I'm trying to find out is, what if somebody gets it from someplace in Reading, the Royal Borough, or Slough, and we find out that the cases are going that way, or people from Slough are getting it from somebody in Wokingham? How are we going back and forth and cooperating with the other boroughs to make sure that we can catch this thing, and to make sure that we can stop the spread like that, rather than trying to just do it individually? We can't just look only in Wokingham. If somebody gets it someplace else, we have to get it. We have to stop it.
You're absolutely right, and I can see that Merredin's come on and put a hand up, which is great from that Berkshire level. Thank you.
Okay, Merredin.
Oh, okay, thanks. we've got a couple of examples where we've had a joint incident management team. We had one jointly with Bracknell Forest because we had a schools issue that covered both Wokingham and Bracknell Forest because the schools shared some taxi services for children and also some cleaners. So we had a joint IMT. When we also did joint work when Tesco's. Early on, there was Tesco's Wokingham and Tesco's in, was that one in Bracknell Forest? Staff worked between the two. So we worked jointly on that one, and EHOs both went to both the Tesco's to review their practices, and actually Tesco's was quite hard to work with. so there was some joint work going on there, working with the head office with Tesco's. So actually we've got a number of examples where we do joint work, and we've got a joint health protection cell with health protection specialists that work across all 6 councils and are doing joint training across the councils. Fundamentally, each council runs its own contact tracing, which is great, concentrates on its own, but it's very easy for us to do joint work. I've also had some MOUs agreed with Swindon, with where else? Hillingdon in London, and all the places that border on Berkshire. We've shared phone numbers, we've shared lead details. So if we have any issues that affect any of our our neighbouring boroughs, then we've got the phone numbers, we've got the contacts, we contact them direct, we can do things very quickly. And I have to say, I have shared with Oxford. There was an issue related to somebody who came from Oxford Hospital, went to one of our care homes and wasn't tested and caused a problem. So went straight back to Oxford to check their procedures, which they did, and they were mortified that they hadn't done it. So we've got quite a few examples of where we're doing joint work across boroughs.
Sounds like we should be endorsing all of the problems they're having nationally, because the national test and trace is exceedingly expensive and exceedingly unreliable and not exactly doing the job it's supposed to be doing. In fact, we've got the most expensive test and trace program, I think, in Europe at this point, and it seems to be doing less than anybody else. So maybe they should take Wokingham and use us for the example for doing the test and trace, and pay Wokingham the millions of pounds they're paying this private contractors to do it.
Good point, Rochelle. Okay, any more comment, Meriden? No, okay, in that case, then Andy.
Thank you, Chair. Just a reminder, really, that this is a scrutiny committee, and the role of the scrutiny committee is to scrutinise the workings of the council, the executive, and the officers. And it's felt a little bit a short while ago like this was an education session for John, and this isn't really the place for John to be exhorting us onwards. I'm sure there are other forums that will welcome those exhortations. I suspect also. Sorry, it is leading up to a question. It is leading up to a question. Also, the idea that John's a bit out of his depth in terms of his comments on the national lockdown. That's something Sage asked for several weeks ago. I understand it's not for John to come here and to preach to us about what national policy is. He should stick to his own pay grade. My question is for Meriden, and I want to go back to this idea of community transmissions, because we've said that there aren't really the outbreaks happening, or they're not the main driver of transmission, but it's in the community. And I understand that in the community, people are sort of thinking it's within households, but my fear is that because of the rule of 6, we have very, very small meetings of people in, say, a pub or a cafe, and if just one person gets infected, it could actually be quite difficult to trace it back and to associate them with the other 6, just because most of the other 6 won't have infections. Is that a concern that she has, is that transmissions are happening in particular sectors, in particular locations, but we're just not able to pick them up because most people are asymptomatic?
Meriden.
Right. The issue about the asymptomatic and the ones with not very significant symptoms does tend to be the young people, and that's one of the reasons why it's spread through universities quite quickly. In terms of us not knowing where some of the community transmission, it is likely to be amongst families and family groupings and friends. But the idea of test and trace is as soon as you find a case, if you identify all their contacts and if all those contacts isolate as they're asked to, we shouldn't really be getting more community spread. I think what's happening is, and we have had a couple of examples where people have felt they needed to go to work, they couldn't afford not to, they're waiting for a test, they had symptoms, so they still went to work, and it ended up spreading amongst others. So it's those kinds of things that are enabling the spread. And I can perfectly understand people's financial circumstances and people's need to get on with their lives, and it is quite difficult for people. I don't think people are deliberately flouting the rules, but I think the isolation. I can give you one example. It wasn't in this borough. Followed up an outbreak, and we decided to actually phone all the young people to check if they were. Actually, we were offering testing to all of the people working in a particular place, and we rang them all at home because we did arrange testing within 24 hours, and we were told a number of them were out to lunch. They were supposed to be isolating and they weren't. So these young people were not isolating. They thought it was a chance to just go out and have lunch with their friends. So this is why, one of the reasons why it's spreading, it's these sorts of things. So we did, at that point, we did actually ring every young person and explain why they needed to isolate. And we think we got better compliance after that. So there's a number of things that are contributing to it, but where we've got an outbreak, where we contact people and say you need to isolate, it should work in theory. But I don't think everyone's isolating when they're asked to.
Tough job you've got, Meriden. Andy?
No, thank you very much.
You finished. Okay, in that case, we've been through
Chair, if I may, I know my technology is playing up with the mute, but my hand.
You've got your hand up now, have you? For real.
I will come off the call in a minute and then try to re-log in again just to see if it actually works, but I cannot switch things on and off at the moment very well. Part of my first question was just a quick summary of how the first week has gone since the 13th, which I'd just like to hear that just on numbers and to see how it's going, if we could, please. Thank you. Try to switch off.
So from a process perspective and working with public health, it's been really successful. So we've had a significant amount of support both from our local and Berkshire point of view in relation to public health to get set up, but also we've had a significant amount of support from Public Health England, which has been great. From a case perspective, of the cases that are coming through, bearing in mind we only get those cases that NHS Test and Trace can't reach, so it's actually quite a small percentage at the moment, and our success rate is between 25 to 30% of those cases that we get through. Now, one of the things that Susan mentioned is the fact that we are looking to strengthen that success rate, and the way we're doing that is yesterday we launched a text service first to say you're going to receive a call from this number, please make sure you're available. And in addition to that, we're going to start a door knocking service, so where we've got people who we just can't reach because either the telephone number that's been provided doesn't work. We do get the address information, so we will make sure that we get to as many people as possible to increase that success rate.
Thank you, Silly.
Jim, do you need to come back? Because your hand is a bit intermittent.
Hopefully my hand's down now, and I'm just going to log off and try to log back in again to see if I can get my mute to work as well.
Okay.
Thanks.
Thank you.
Thank you.
Right. If there are no more questions, then does anyone have anything else they want to comment on, or any proposals that they would like to make for the executive? Abdul?
Pauline, thank you, Chairman. Just one small clarification. If Meriden, you touched on we have one access point which makes things more faster and more easier. Is very pleased to hear that. So my question goes to, we do have quite a big companies within our borough, and there are a lot of people working night shift, etc. I'm talking about the factory workers. How do we communicate with them if there is any outbreak within their sectors? There are a few of them are working in 1,000 or 1,500 or 500 in their workforces. I'm just wondering what help can we give them, or how do you work with them? Thank you, Meredith.
Okay, who's going to answer that? Meredith.
Yes, I'm happy to answer that. Thankfully, we've had very few outbreaks in businesses. And if we have one case, we don't wait till there's an outbreak of 2 or more linked cases. If we have one case in one of our local businesses, we would be contacting them. We automatically identify a subject matter expert, and quite often it's environmental health. They will contact the business and say, can we review your practices for social distancing and isolation, all the things they should be doing. And we give them advice on contacts. We give them advice on all sorts of things. In terms of contact with businesses that have not had outbreaks, environmental health are doing regular visits. They've had webinars for businesses so they can learn about how to make their businesses COVID secure. So I hope that helps.
Thank you. Susan.
Thanks, Chair. I mentioned a few moments ago about the fact that we're overlaying different kinds of data so that we can really understand and pin down about sort of community transmission. And one of the points that what piece of data that we are adding to this are high risk workplace settings. So to add to the councillor's question, so that information, along with other information that we have about community transmission, will be overlaid, and that might help us in terms of getting more to the heart about our community transmission as well. So just to reassure you that absolutely that's part of understanding and us getting a better understanding and intelligence. So it's not where there have been necessarily outbreaks. It's just that it's to help us actually with our intelligence.
Thank you, Susan. Chairman, can I just one more?
Carry on, Abdul.
Thank you, Susan. Susan, as we all know, BME group is the highest risk at the moment, and we have in our borough ward like Bullmarsh and Whitegates, Early, etc., where there's lots of Asian-oriented people are living in there. What sort of method are you using to communicate with them? What sort of information are you having from their GP or hospitals? I would like to know more about it. If you don't mind, if you can explain a bit more in detail.
So in terms of our community links, we do link our localities team link with a number of community and resident sort of groups that are BME groups. So that's how we've got our sort of community network, if you like. I mean, maybe Meriden could come in on the hospital point that you're making and GPs.
Meriden?
Yes, the whole of the NHS has been asked to come up with plans. Every provider has been asked to come up with plans on how they can reduce inequalities amongst the Black and minority ethnic communities so that we don't see the same in the second wave that we did in the first. So that's one. They've all been asked to come up with plans, but plans don't always mean people do anything different. I do know that Royal Berkshire Hospital have gone to great lengths to do risk assessment for all patients, and where people of Black and minority ethnic backgrounds, they are taking additional precautions. And sometimes it could be more video conferencing as opposed to attending appointments, and certainly GPs are moving to a lot more video conferencing. So I think there's a lot more risk assessment going on, and the other one that they're concentrating on is ensuring that equality of access for Black and minority ethnic patients in all services, and they're monitoring it. So those are the sorts of things that they're doing.
Okay, thank you, Chairman.
Thank you very much. So now, if anybody's got any further comments they want to make or any recommendations to the executive, could you put your hand up now, please? I think everybody's had their say then. Thank you very much. It was a thorough session. Right then, let's move on to item 45, the impact of COVID on poverty, and a very detailed and concerning report, really. But thank you very much for all of the detail in that. Can we start with a brief introduction from any of Laura, Jake Morrison, Annette Meadowcroft, Emma Cantrell, or Simon Price? Any of you that would like to chip in, just put your hand up and start. Who would like to begin?
We just say, Abdul, you're sharing your screen.
No, I've got thrown off. If you just give me a second, I'll try and throw myself on again. I may have to leave the meeting and come back. Meanwhile, Andy, you carry on.
No, I just wanted to say, Chair, that it's Annette Medhurst. Her name is Annette Medhurst, not Meadowcroft.
There has been some serious technical issues going on with Microsoft for the last 3 days, and it's affecting a lot of the.
I think Alison, Vice Chair. Guy?
Yeah, Alison's Vice Chair. I'm just explaining that there's some bugs in the system today, and for the last couple of days, it's been affecting everyone.
Yeah.
Over to you, Alison, I think.
Abdul, you're still showing your screen.
The meeting. I'm not, am I?
Oh no, that's fine. It's Abdul. He's stopped it now.
Right, I'm back. Is everybody else still on? Was it just my computer?
We're still here, Chair.
We're fine.
We're still here.
Oh, jolly good. I'm sorry, Andy, I wasn't able to hear what you said. Would you mind repeating it? Sorry.
I was just saying, Chair, that the food bank, the Wokingham Food Bank manager, her name is Annette Medhurst, not Meadowcroft.
Oh, I do beg your pardon. My fault.
I'm sure she'll be fine.
Would any of those people like to speak? In which case, then I'll move straight to the questions, and this time I'll go backwards in alphabetical order for the people that would like to ask about the poverty report. So questions first. Oh, Jake, you'd like to speak?
Thank you, Chair.
Yes, go ahead. Thank you.
I thought that Laura was introducing the report, but I just wanted to say that we're obviously happy to submit our data to this, and we do plan to do a presentation briefing for all borough, town and parish councillors at some point in November. So that's something that we've been planning for a couple of weeks now, just to give a better insight into each of the wards and parish and town council areas. So we're certainly happy to answer any questions, and if there's anything technical or specific which I don't deal with, then we'll happily follow it up with you from our advisors.
Thanks, Jake. Will that be with all of the parish and town councils together, or will you be visiting each in turn?
It's however councillors want to address it, really, Chair. We're happy to do it in any way. So.
Okay, that's fine. Right then, Sarah, and then Andrew, and Jim, is your hand up this time?
Yes, and I can mute and unmute at last.
Okay, Sarah.
Okay, I've got quite a few, so what I'll do is I'll do a few now, and then I'll let other people have a go and come back later, if that's okay.
Yeah, sure.
Before I ask some specific questions, that there was a general point I wanted to make, and it's not just related to this report, but it's the narrative I've generally heard come out of the council when it comes to the issue of poverty. And whilst I appreciate that compared to other parts of the country, our levels of deprivation and poverty are lower in comparison, sometimes it can come across a bit like, well, it's not so much of an issue. And the data that we're seeing is, we're talking over 7,000 children in this borough that live in relative poverty. And the fact that that is on the low end of the scale is shocking, quite frankly. I also noticed it with the fuel poverty stats there, 5.4% of households, and it was put down as low. That's still 3,500 households. And it's not just in this report, it came up at corporate parenting last night, it's come up in other meetings as well. It's a request, and I will possibly put this into a recommendation, and I'll propose this maybe that we can discuss later. But it's a request that we are very careful with the language that we use at the authority, because it is a serious situation, and I think we should limit the use of comparative data and benchmarking narrative, such as what I've mentioned when talking about poverty, except when we're making specific reference to reduction in poverty, because that is something that is positive that we can share. We already have poor representation of people in poverty in the media as it is, and we need to change that narrative so that everyone realises what an issue it is and that we need to deal with it. So I guess at this point, I would like to make a proposal that this committee recommends to the executive that this council will limit the use of comparative data and benchmarking narrative when talking about poverty, except as I mentioned in making specific reference to reduction in poverty.
Thank you, Sarah. I must say, when I read the report, that wasn't the way I saw it, but you phoned me this afternoon and we talked about it, and I can see exactly how it can come over like that. So I have a lot of sympathy with what you say, because for every one of those families and children, that's 100%, isn't it? It's not 17% or 20%, it's total for them. So I have a lot of sympathy with your point of view. When we come to the proposals in a moment, then maybe you could give that resolution again, and if somebody seconds it, then we'll make that as one of the recommendations. So let's park it for the moment, and we will come back. Did you have any questions?
Yeah, I do. I have a few. I mean, just firstly, a point of clarity. I can't find one, and I haven't found anyone that has found one, but can I just confirm, does this council have a strategy based on reducing poverty and anti-poverty strategy? Do we have one?
Who's going to answer that?
Shall I respond to that? No,
yes,
no, we don't have a current strategy. No.
Okay. I will make a further recommendation when we come to recommendations then on that. Thank you. Then some other sort of deeper questions. Firstly, it does state in the report that obviously a number of interventions can be done by the council, but there are some issues that cannot be resolved at local level and restricted by central government policy. I note that when it comes to housing numbers, this local authority is very good at lobbying government. It obviously feels that that is effective in having a say over central government policy. And as such, looking at all the efforts that have gone into lobbying the government on housing numbers, are there any plans for similar efforts being put into lobbying policies that impact on poverty? Are we aware of any plans to do that?
Laura, have you got an answer for that?
No, I think from my point of view, there's a few people with their hands up. Jake's just popped his hand up.
Okay, lovely.
From my point of view, from our side, it's really monitoring the situation and looking to target those interventions accordingly to take action what we can do locally. But I see perhaps Jake wants to respond on that point more fully.
Thank you, Jake.
Thank you both. Yeah, sorry, Councillor Kerr, it's obviously not in relation to the council, because as you know, I don't speak for the council, but what I wanted to be clear that the dual aim of Sit-ins Advice is also to campaign for change. So that was initiated 81 years ago when it was set up, that we don't just help individuals, we then also use that insight to then campaign for change. So a lot of that at the moment is going on still with universal credit and trying to argue for changes with that. So when we present our data, it's not then just for contract monitoring purposes, it's also then used on a national scale with governments and assemblies as well, depending on where we are in England and Wales at the time. But we do use that to influence government, and it can be on an individual case if there is something like discrimination, or when we've seen issues with mental health and they've fallen through the gaps with PIP, for example, we'll then use those stories to influence MPs and government departments.
Thank you. And do you think there's merit in local authorities lobbying on these issues as well? I mean, we've all seen how we're lobbying hard on housing numbers. If the same efforts were put into poverty, would that help?
Yeah, I hope this doesn't get me into trouble because I know Susan's about to comment on, but I did meet with Keely Clements today, and we've been meeting a few times over the last couple of weeks to talk about this, and certainly Simon as well, who I know is on the call. We do feed things through to the council, and I do obviously think that would help add extra weight to it, and certainly just in engaging with local MPs and the executive locally as well. So we'd certainly encourage that. But I would say certainly that I know this is not about COVID because, as you say, poverty existed before COVID in Wokingham, but the partnership working that has come from the COVID pandemic can't be underestimated. So I think we only have a brighter future with supporting our local communities now that we've got that partnership effectively working together.
No, thank you. Well, while we're on the topic of partnership working, so this is obviously for you, it's also for Emma and Annette as well. I'd like to understand your thoughts on partnership working pre-COVID, obviously what's happened during COVID, and if you feel that that relationship is continuing in the way it should, or if there needs to be improvements in that partnership working to ensure that actually collectively poverty is being tackled locally.
Would you like me to just answer while I'm on the screen, Councillor Kate? So I met with Susan. I was pleased to meet Susan as soon as she joined last year, and I'm sure Susan would say if she comes on the screen that I offloaded a lot of thoughts on what we could be doing to bring people together. So I don't think it's any shock that we feel that the partnership is so much better now. So I was describing this to our trustees before, actually, the Simon Price and Susan were the only council officers that we'd liaised with pre-COVID, and I'd been here just over a year at that point. But now I'm meeting with 7 or 8 assistant directors and director level officers on a monthly basis. So that relationship has definitely improved. And that means that, like this report today, we're able to contribute a lot more in-service staff in initial mental health capacity, vulnerability, identifying advice issues, responding to some debt issues like bailiffs. And Keely's already agreed to train her frontline staff on that, working with Sit and Device early next year. So that's only happened because of that initial COVID-19 phase 1 response.
I'm pleased to hear that, Jake. Thank you for saying that. I really do hope that partnership can continue. Susan had your hand up a little while ago. I didn't know if you wanted to chip in on the previous question.
I think just in terms of lobbying, that of course that we will and can lobby, and we do lobby, and there's nothing to stop us from lobbying in the future with regards to poverty. We're also very active in sort of regional groups that are, and themes which are relevant to the areas that Councillor Kerr's actually raising too. So and I don't want to say too much about partnership, because I think that for me, partnership is really the main way to actually achieve the best outcomes that we want. And it's great for Jake to say what he has said, and I'm sort of really delighted that we have moved forward in terms of partnerships in the way that we have, in particular over or since the start of COVID. And I think the partners, the voluntary sector partners, have been in this borough absolutely fantastic. So I really wanted to thank them for their work, because I mean it is only through true partnership that we can get those best outcomes. So thank you very much.
Thank you. Sarah, could you finish?
Well, so I also asked if Emma and Annette could also answer my question about the partnership working, please.
Right. Either of you willing to come in? That's Annette and Emma Cantrell.
Hello, I did have my hand up. I'm not sure if you saw.
Yes, I did. I wasn't sure which Emma it was. It's you. Carry on.
The common thing. So yeah, a couple of things. Firstly, the question about whether there's merit in the council lobbying government. What I would say is that whilst the problem of poverty is very, very real for every family in this borough who is suffering, the fact that the numbers are relatively low means that actually we can make some big changes, and we've got, it's not an insurmountable problem. So actually, I think, lobbying could be very, very valuable, but actually on a local level, if we can really work to do things that make a big difference and lower our numbers, that could be exemplary for other similar authorities in our position. So I think that could be a great thing. And on the partnership working, I think I totally agree that partnership working is the way forward to, make real lasting impact on this issue. But I think there's a real difference between the services that the council commissions and those that aren't commissioned and funded by the local authority. For us at First Days, we were very much not on the council's radar, apart from on the frontline level. So we work really, really closely with people working on the front line with families. So we've got a really good relationship with those local authority teams. But what we've never had is that relationship with the decision makers before. And, obviously we played a part in the pandemic response, which kind of got us on the radar, I suppose. But I do think there's a big difference between the level of relationship with the voluntary sector, where there is commissioning relationships, and where there's actually, where there's no relationship like that. And I think that's something that could be worked on a lot closer, because, not all charities are interested in funding, but actually from First Day's point of view, we are more interested in the relationship with the local authority and working on projects that don't necessarily need any local authority funding, but actually buy-in and influence are just as valuable. So we would really like to see partnerships working in that way initially.
Thank you. John Horsell, you wanted to come in on that before we come back to Sarah?
Can I just ask what was there? So would you welcome the opportunity to be part of a co-produced anti-poverty strategy in that regard then?
Absolutely, that would be fantastic. And I think that co-production part is vital, and getting a broad range of, there are many anti-poverty charities, or many elements of different charities work that are anti-poverty in the borough. And I think getting all of those people involved is the way forward, definitely.
John Horsell.
Put the council's point of view, we created a structure in the first pandemic, the first wave, which was very much directed at getting all of our partnerships working with the borough and making sure that all the partnerships were supported by the borough. We are just about to go into a particularly difficult period, which will last for 3 or 4 months. And I'm extremely conscious of the fact that we've got to try and pick up anybody who is suffering as a consequence. And it's not really the time to write policies or statements, but it's really the time for the whole of the councillor group and officer group to direct the resources we have, which aren't unlimited, to where it's absolutely necessary and where it can do the most good. And that's what we will be doing for the next 2 or 3 months.
Thank you, John. Okay, Sarah, is that the end of your questions for the moment?
It's not the end, but I'll come back in later.
Okay, thank you. Going backwards through the alphabet then, I've got Andy Croy. Jim, I don't know whether your hand is up or not, but if it is, then it will come to you. Guy, and then Andrew. So, Andy.
Thank you, Chair. First of all, thank you, Laura, for writing, I think, what in some ways is a typically excellent report from the officers. The amount of detail and work that went into it was evident, and thank you for that. I just want to pick up on a general thing, and it's that the Borough Council has relatively few levers that it can pull, and alongside that, we've seen with COVID that some groups are going to be affected or have been affected more by COVID and its intersectionality with poverty than others. And in particular, we're looking at people from disadvantaged backgrounds, people with lower educational outcomes, and the young. And one thing I thought that was missing from this report was care leavers. Now, at the moment, care leavers in the borough up to the age of 21 are exempt from paying council tax. Care leavers over the age of 21 and up to the age of 25, at which point our corporate responsibility for them ends, are still required to pay council tax. Now, it seems to me that given we have relatively few levers that we can pull, and that this is a very small group, and that these are relatively small sums of money for the borough, but possibly life-changing demands for these most vulnerable of young people, that this is something that we should be doing now. As I've forgotten the name of the committee now, I've forgotten the name of the committee, as has been requested, I think.
Corporate Parenting Board, Andy.
Thank you very much. As the Corporate Parenting Board has requested, that the executive and the senior leadership team should agree to take that group of young people out of paying council tax. I'm sorry if that came over a little bit garbled. So that's really a question aimed at John Horsall and Susan Parsonage. Not while we've got you here, rather than going through the Corporate Parenting Board, which hasn't had any success, even though it's been trying for a year to get this done. Why don't we take the opportunity now to make the lives of these young people just a little bit easier? It won't cost very much.
This is a financial question in a way, so could I ask John Horsall if he would like to come and give an answer?
Very much so. Andy made a big point of pointing out to me just half an hour ago that there's an Overview and Scrutiny Committee. It is not a decision-making body.
Thank you, John. Thank you, and you're absolutely right, John. It's not a decision-making body. Otherwise, I think we would make the decision to take those people out of having to pay council tax. You're the decision maker. Susan's the decision maker. You are the guys who should be doing the right thing and going away and making the right decision for these people. It's come out of scrutiny because the scrutiny report has made clear that this group of people will be amongst the most vulnerable because of COVID, and that the borough council has very few levers than it can pull. This is one of them, and this is what we should be doing.
Andy, it's going through community and corporates looking at the budget process at the moment, and adult and social care and children's social care is coming up.
This is for John and for Susan to take away rather than for you to explain away.
I'm not explaining it away. I'm stating that if we don't know what is going to be in the budget yet, if it's there, it's there.
The budget is from next April, so that's 6 months.
Andy,
that's 6 months. Budget's irrelevant.
Chairman, can we stick to the agenda?
Can you let Guy speak, because he is chairing the Overview and Scrutiny Committee that's looking at the budget. So I think some clarification would be useful. Thank you, Guy.
If this isn't, if the top question is basically asking for it for effectively next year, then the budget setting process is ongoing, and this is a question that can be asked to John Kaiser and the other members in regards to what's going on for next year. If it's in regards to, I thought the executive had already made this decision for an aspect of this previously as well.
They've made the decision not
to. A year or two ago, they did decide that we couldn't afford to do it. It was was looked at by the executive. I remember, because I was on the executive at the time and I was actually promoting it, but it was decided that we couldn't afford it. So no doubt it'll come up in the budget if it's in there. I think you'll have to wait and see, Andy.
The request that's been put in is for this year, not for next year. I understand the budget setting, but this is for this year. The Corporate Parenting Board put the case in, I think, last October. Okay, they put it again in February, and I know it was discussed last night. Okay, this is the senior leadership of the borough who can change this, who can influence this, sitting on their heels for I don't know what reason.
Can I just quickly say something?
Sarah, can I ask John if he'd come back on that at the moment, please?
I'm very happy to come back on that, but this is not a decision-making body. This is an Overview and Scrutiny Committee, and it makes recommendations. So, Andy, you've got to observe your own rules, matey.
Can I just make a suggestion that a recommendation is made when we get to the end of this?
Yes,
just on Andy's
at the moment we're still on questions. I was about to say that, Sarah. So please let's stick to the questions, and then we should come to recommendations later.
Could I just make a very quick point? Just to say, having discussed this at Corporate Parenting Board, as Andy says, this is not about next year's. Officers have already determined that there is enough already.
What's the question, Sarah? What's
There
your
was
question?
enough.
You can comment in a minute. Let's
It's
get
just
all the
while we're on-
questions out of the way.
While
So
we're on
if
the
you've got a
point,
question, carry on.
I will come to my questions later. I just wanted to make the point that the officers have already said that there's enough money left in the budget specifically for taking away council tax for up to 25. The money's already there. So it's not a case of getting it for next year's budget, but we'll talk about it in the recommendations. I just wanted to go with Andy's point.
Question mark. Okay, Guy.
Chair Susan, I think, wants to come in here.
Oh yes, sure, Susan. Yeah.
And yes, I just wanted to say that this, I think it's important that it is covered in the budget process. And although the point has just been made about the fact that the budget there, well, it is there. Well, in actual fact, if we look at the Children's Services budget, there are a number of overspends on the Children's Services budget. So because of the different pressures that we have in Children's Services around home to school transport and placements. So it's not as simple as just saying the budget's there. When we look at budgets, we need to look at the budget in the round, and that is when it will be looked at in the budget process. That's the correct way to do it. It's not correct just to say that the budget is there, because there are overspends right now.
Yeah, the budget isn't cut and dried yet, so thank you, Susan, for that. Right, Guy, your question.
Thank you, Chair. I must admit, this has been one of the most interesting and eye-opening report that I have read, and perhaps one of the most detailed report that I have read in quite some time. It's also quite an eye-opening one. Now, there's a general question here to start with, and because I seem to recall from, I cannot remember if I read it in the SMC report or if I read it elsewhere previously, that the median, that the way that poverty is measured in general terms in the UK is it's 60% of the median wage, if I remember correctly, which, if I'm doing the maths correctly, that's about £18,000 per annum. Do we have any comparative on what that is in Wokingham? I know it's a general question and it's not going to be an exact answer. I just want to know where the comparison is, because £18,000 in Wokingham goes a lot less further than £18,000 somewhere in Norfolk, Cornwall or Northumbria.
Laura, do you have an answer for that?
Thanks, Chair. No, I don't. I could probably find the answer, unless there's another officer on the call who's got that to hand. We can probably get that and share that, but no, I don't have that to hand.
Does anybody else have that number? Otherwise, Laura, yes, please, if you could research that and give an email perhaps to all of us so that we all get the answer to that, because it's a very pertinent question. Thank you. Guy?
Thank you. The other aspect on this is looking at the I was looking at the food insecurity section of the report as well. So this may be a question for our colleagues who do the excellent work at the food bank and maybe CAB as well. But it's looking at the number of people fed and how it dropped down in August from its peak in April. So I presume that was basically the effect that basically businesses were coming back to life and the economy was starting to be stimulated a bit. As a result, is that the case? But also with everything beginning to contract again and everything, how do you perceive, again to our colleagues in the food bank, how do you think it's going to happen in the next few months? Are we going to see that sort of spike that we saw in March, April, May, June, and then peter off again as things get back to normality?
Yeah, sure. So the honest answer, of course, is we don't know. But we think, yes, the numbers will go up again. Obviously, there was that massive peak at the start of lockdown. It kind of tapered off in the summer. I think that was probably a combination of things. But as you quite rightly pointed out, people were going back to work. I mean, anecdotally, a lot of the people that came to us, for example, were cleaners who'd been furloughed, for example, and going down to 80% of their salary actually just wasn't enough for food. Maybe they had their children at home as well, and ordinarily their kids were at school getting a hot meal, but they were all at home. So there were additional pressures. At the moment, our numbers are reasonably stable, but the Trussell Trust, who oversee quite a lot of the sort of food bank network in the UK, are certainly predicting that numbers will start going up as furlough comes to an end, as the sort of months go on over the winter. So that's kind of what we're preparing for, is the numbers to go up in the sort of foreseeable future.
Thank you. At least that gives us a context in that regard. The other aspect is it's more a general observation, having skimmed through the SMC report, and I think I can't remember who mentioned it. I think it was Sarah, where basically we need to be starting to lobby the government to make changes, because the one number that is striking has been effectively that in terms of the rough percentage of poverty, the poverty rate, however we look to use it, it doesn't seem to have actually gone down in 20 years. It seems to have roughly been bubbling along the same line. So I do think that we need to actually take that opportunity to lobby the government to effectively try and think a little outside the box and try and solve these problems that have caused this issue with this, because there's nothing it really hasn't changed in 20 years. The one aspect that does seem to have dropped down is pensioners in poverty. So that there were some radical ideas that were done in the early 2000s for that, and it appears to have worked. But the children seems to be roughly the same percentage wise, and with the population having increased, that means we've seen a real numbers increase as opposed to a decrease. So we need to think a bit more outside the box and lobby the government on things like taking the lowest paid out of tax altogether. Now we're leaving the EU, basically get rid of stealth taxes like VAT on core essential things like food. It's things like that, and basically get those that have the least in society should not be penalized by taxes, especially if they can't, they shouldn't be paying them in the first place because they have got the least in society. That's the way I think we need to start leveraging it. So lobbying the government and putting in suggestions such as that, I think is going to go in a lot further than in addition to what we can do locally. We can do a bit locally, but there are some issues that are just so far beyond us. And let's all be honest, council tax was due to be reviewed, I believe it was 20 years ago, in regards to its percentages and everything like that, but it hasn't been touched since the changes came back in the early 90s. So there is a lot more that we need to do on that regard.
Jeff, let's come in on that.
Yeah, if I can. Sorry, Councillor Grandison, it's a bit of a spin on your point, but it just led me to think about what you were saying. I think I've been here now in Wokingham for 2 years, and the first thing that was pretty evident to me through the feedback we were getting from clients, but also councillors, was about people not being as confident to ask for help in this borough as they might be somewhere else, where they're more familiar and surrounded by people who are also in need and are vulnerable. So one of the big things that we've been trying to do, and certainly have been doing through the One Front Door to the charity sector, is the message about it's okay to sort of ask for help. And we've been really keen to, we're not seeing a huge rise in debt cases at the moment, but we will do over the next couple of months, and we will do early next year. And that's where, again, obviously we expect that's where bank usage will obviously also massively increase as well. We've got to absolutely shout about that message that it's okay to ask for help and that those services are available. And that's where that partnership working is also really, really important. And obviously that's why we're pleased that the council tax protocol, for example, has been signed and agreed, because that's another method of being able to access people at those earlier stages. It's quite rare for someone just to have a problem with council tax. They will normally have other bills that they haven't paid as well or can't pay. So that's really the key message from me and Sinton's advice.
Okay,
that's to be honest, music to my ears, because, and this is it's a psychological thing as well, because I'm sitting here right now in complete agony because I have managed to harm a rather old rugby injury where I slipped a disc when I was in my early teens, and I am currently waiting for a chiropractor to call me back because I can barely move at the moment. And it's that shame of not asking for help. And for years I've put off and put off and put off doing this, and it's physically impacted me at the moment. So yeah, I'm very glad to hear that we're doing that, and anything else that you want the council, and especially myself as the chair of community and corporate, as part of this does fall under my remit. My details are on the website. Give me a call. I'm happy to have an argument with someone if required. I'm not afraid to speak my mind and ask the hard questions if required. Thank you, Jake. That was very useful. I'm done for the time being, Pauline.
Thank you very much. I've got almost everybody's hand up, so please could you just stick to questions for the moment, and then we'll come to comments afterwards. Jim, is your hand up to ask a question?
It is indeed, Chair, if I can.
Right.
Okay. First is a request. I think we said earlier that one family living in this sort of situation is one too many. Showing percentages of increases doesn't help us understand the scale of the problem. It would be very useful if we have the numerical numbers that go with it as well. An increase between 1 and 4 has certain interventions that locally we can do. An increase between 400 and 1600, if my maths is right, is a different set of interventions. So the numericals there would be good to have. My question, Chair, is how do we measure this? Because if I read through the report, and I must admit I haven't read all 200 and some odd pages, but it refers to, on page 28, no single definition or measure, and on page 59, experimental statistics. How do we know that we're getting the right information to identify the right people to try to help? Is my question.
Laura?
I think that's where our local data and insight comes in, and certainly that information on the ground from the voluntary sector. It's about collecting all of that together, because that is part of the issue, is that national picture, and that national measure isn't necessarily consistent. So it's really looking at it in that more granular detail should give us a good picture of what's happening here in Wokingham. And if we can get those measures right, and that's what we're looking to build on. So the conclusion of my report is actually, let's get those measures right. Let's really drill down and understand what we can measure and monitor over the coming years. Well, more closely than that, in the coming months, more importantly at the moment, so that we can really use that to target interventions and see if we're turning the dial. But it's so broad, we need to look at a broad set of indicators at the local level to really monitor that.
So, Laura, we're saying that it's a reactive measure. We're waiting for people to contact us to let us know, and there's not really a lot of proactive stuff we can do. Is that what I'm listening to, or did I misinterpret that?
Well, there may be opportunities for that. No, so there's data that we collect as a matter of course, where people are accessing our services, so we can proactively gather that, and that's really what we need to build on. So it's not necessarily a matter of waiting for that data from central government, but yeah, it's there. It's a matter of bringing that all together and really building that insight based on what we collect and the access and the engagement that we have with our residents on a regular basis.
Okay, lovely. Thank you very much.
Thank you, Jim. Emma Hobbs.
Thank you, Madam Chairman. This is a question really for Jake. I know I'm on the trustees, but I've only joined really today. It's my first meeting. I just want to ask him: does he work with Charles and the executive regarding the sort of help and requirements from the various clients within Wokingham?
Jake?
Thanks, Chair. Thanks, Councillor Hobbs. Yeah, I think this started back when, so as I said, I met Susan, but before that I'd met Julian McGee-Sumners, and again we talked about the council tax protocol at that point, and that had led to engagement with Simon and introducing the council tax arrears project that we have in place, which is a once-a-month surgery with officers from the council tax collections team and our debt advice project at Citizens Advice Wokingham, which has been a great project over that time. And then obviously, as John Housel and John Kaiser and Charles and Ula Karen Clark as well, we've met over that period of time about different matters. So certainly with John Housel originally, it was more how do we get into the council a bit more, because I think being a holistic charity, it's quite hard sometimes to identify where we fit. And we've got a lot of insight into what our communities are facing, that it doesn't just fit naturally with one team. So again, that's why I talk about COVID being a really interesting insight into partnership work and having that similar experience to have to fight for. So obviously that brings us then to Charles and John Kaiser particularly, who have been obviously particularly supportive during that time as well, and Charles with the hub and looking at the voluntary sector strategy and our inputs into that as well.
Thank you, Jake. Thank you. That's all, Emma, is it from you?
Thanks, Jake. That's it. Thank you, Madam Chairman.
Okay, and Andrew?
Yes, thank you. I'd like to ask 3 questions, if I may. Yes. Firstly, how are schools being supported to cope with the growing number of pupils in poverty, including in identifying the signs of children in poverty who were not on the school's radar before? Secondly, a lot of referrals are to the voluntary sector. How is WBC monitoring the capacity of different voluntary sector groups to provide these services and the quality of the services provided? And are there any additional types of support that WBC might be able to realistically offer to help the voluntary sector? And my final question is specifically to Jake, and it's about citizens' advice. Are the BAME numbers underrepresented in approaches to CAB? Given the diversity that exists within the BME community and the importance of engaging with it, is sufficiently granular data available to identify particular subsets within the BME community who are hardest to reach? So are they underrepresented? And then are there particular subsets that we actually have the data to be able to use, effectively to engage with them? Thank you.
Jake, can you deal with that last question first, and I'll go to Laura.
Yeah, sorry, I like going ahead of Simon in terms of rank here. So, so yeah, thank you, Councillor. I unfortunately don't have the data in front of me, but this is something that we obviously look at quite often. So we are not underrepresentative of the BME community in Wokingham Borough. We're overrepresentative in terms of the accessing of the service compared to other Citizens Advice. But particularly, I would blame that on the one front door issue, particularly because people had to use that number to get access to food and prescriptions. There was no other real way of then people generally being able to do so. So I would only credit that because of the constant communications from the council and others about that. It meant that we reached everyone in our communities. But what we have done is to get them funding for the free phones, for example, and then where we're putting them out in the community for locations. We're looking to work with the likes of the Indian Community Association, who I met with last year, and talked to us about accessing the Woodley office and how they felt that some of their members didn't find it comfortable to access the Woodley office because it was too small and it wasn't necessarily an environment that they wanted to go into that was a bit strange. So we were then talking about hosting a regular surgery at their community centre that they host. So it's that type of work that we need to continue to focus on. But also, as I addressed, I think it was to Councillor Kerr before, around the work with Keely Clemens' team, the Advice First Aiders programme that we're introducing in December, January will be for a similar reason as well. So we want to work particularly with faith groups and BME groups and other hard to reach groups as well, such as LGBT community and others, to make sure that they don't necessarily need to come to us, but the workers that they already engage with will have that awareness and hopefully confidence in us to be able to then deliver that service. So then that'll be a good link in. But But if I could also just quickly answer upon, which I know it wasn't a question of us other than the council, but in terms of capacity and quality, so the council have been really supportive, and I think Simon might talk about the depth work that we're doing that is increased. But when we have gone to the council and said we do need this support, we have more often than not, certainly during COVID, got it. So yes, it's more medium, short term, but we have got that support that we need. And on quality, we have a membership requirement through Sit Interface that we obviously then subscribe to, where a selection of cases are checked by us locally every month and then audited by national office to make sure that and the good quality advice on that as well. But working with the likes of Laura, who's obviously written this report, we're talking about what more insight of data we've got, because we can give you the headline figures as you've been talking about, but we've got really detailed figures on lower super output areas. So we've got areas of streets, clusters of streets within Norries, within Bulmesh and Whitegates that come to us more often than other areas, where we could target more support through the community engagement officers, for example. So we want to do this a little bit more intelligently when we move forward post-lockdown. Post-lockdown, I'm not envisaging a lockdown, but it's post-second wave, should we say.
Thank you.
Laura, do you want to come back in now?
Pauline, shall I comment on this one a moment?
Yes, if you wouldn't mind. Thank you.
So just on the capacity issue that Jake picked up on, we've been in discussions now for a number of weeks around what sort of front end we need to put in place for debt advice across the borough. And I can confirm that, and Jake can chip in as well, Jake's appointed 2 people to roles within CAB. In the last week or so, the local authority is funding one of those. We're also funding, I understand, other charities, charitable organisations with money, so they can bring in people to assist in the COVID response as well. So I think there are ongoing discussions around capacity, and it's a good question. And I'm sure Jake will continue to speak to us about ongoing issues and additional responses that we need to put in place. So they're ongoing, Andrew, but they should always continue.
Okay, thank you. Thank you very much. Laura, did you want to pop in on that one? Or do you think we've covered it?
I think we've covered off the quality side of our work with the voluntary sector, etc. We don't have a rep tonight from the education area. However, I do know that Mark Redfern's localities team do work very closely with schools, and I don't know if Mark wants to elaborate on the work that the community engagement officers do with families and children, and some of that's very much connected with schools. Yes,
is Mark here?
Yes, Chair, here I am.
Yes.
Hi, good to be here. Yeah, so we have community engagement officers based in the most sort of deprived areas of the borough, which historically have been places like the Norries area and Gorse Ride and Shinfield Rise. And so the work they do there is to engage directly with families to understand their sort of specific issues and try and take a holistic approach to understanding how they can, one, get help and support they may need initially, which can involve a lot of work directly with schools in terms of understanding how, additional work in the schools can support them, but also in terms of how they can develop themselves in terms of leading more self-sustaining lifestyles. And that can be often in terms of activities that they do in terms of confidence building, more skills in terms of doing things in their local area, which again is some of the stuff that goes hand in glove with a lot of what schools are trying to do in terms of with their pupils and helping that sense of engagement, feel a sense of confidence. And one of the points that Jake mentioned earlier in terms of people feeling that they can connect with other people and have that sort of dialogue and share their experiences is a very important part of that as well. So it's one of those things where we try to make sure that our sort of front end in terms of this delivery has a very human sort of angle to it.
Okay, thank you very much. Right, Andrew, is that sufficient? Okay, and I've got Alison.
Thank you, Chairman. As Guy mentioned earlier, the national report showed that there has been progress made, so that the proportion of pensioners living in poverty has reduced. I didn't find anything specific in Laura's report about pensioners in Wokingham, so that was something I wanted to ask about, and what partner charities, voluntary organisations we're working with in Wokingham to help our pensioners. Well, I'll let you expand on that, Laura.
Laura?
Hi, yes. So I can't bring anything specific of what we do there. I think it's much more general. That's something that I didn't go into great detail on. We focused on the work in terms of families and children, given that's where we're seeing the increasing rise. It may be something that I can come back to you on. We haven't got anyone here from the adult social care side of things either tonight. But again, if there's any other officers who know of any interventions across the borough, obviously there's, Age UK, things like that. But Simon, you might be able to elaborate a little bit more than me on that. Thank you.
Yes.
Yeah. So I do know that Martin Sloan is engaged with Age UK. It's really interesting. We are seeing a number of people approaching advice agencies who are of the older generation now. So you're seeing the post-50s who have actually never really bothered with the council because they've never needed to. But I know Age UK are seeing a number of clients come through the door who have lost their job and are now looking at how they have to come to terms with maybe retirement, struggling to find a job. So I know there's a piece of work ongoing with that cohort, and I believe that cohort will get bigger in Wokingham. That's what I'm working on at the moment.
Right, thank you.
Sorry, Pauline.
Yeah, carry on.
I wondered if I could ask Annette about the proportion of the food bank clients who are pensioners.
I was going to comment. I don't have the numbers in front of me, and so it's quite anecdotal, really. Typically, the food bank mostly sees younger households. We don't generally see a lot of pensioners, but I would say anecdotally, actually, that number has gone up a bit over COVID. But I need to sort of have a good look at the numbers, really. So at the moment, it's just kind of a feeling I have that we are seeing more people through the door from those sort of slightly older populations across the borough. But I would need to pull out the actual numbers for you, really, and I can certainly get that information to you.
Yeah, I think there's a challenge with our older people living in poverty, but then they don't have a smartphone and go on Facebook, or that they don't necessarily know that the food bank is something that they could go to.
Absolutely, and looking at some of those barriers is something that we really want to be looking at. I think sort of during COVID, a lot of people came into us, and now that we are in a little bit of a lull, it's one of the things that we're looking at is how can we make sure that actually everyone out there in the community knows who we are, knows what we do, and how to access the food that we're able to provide. And it's something I am concerned about, is that there are some people out there who they don't really know, or they don't really know how to get a referral, or actually they want to have this sort of stiff upper lip and actually no, I am really struggling, but I'm not going to reach out. And we need to be able to break down those barriers, and it's something we need to work really hard on.
Yes, people need to be able to retain their pride in looking after themselves.
Yeah,
and realise there's no
dignity.
reflection in asking for some help.
Absolutely, definitely.
Thank you, Annette, and thank you, Simon.
Yeah. Emma, did you want to come in on that?
Hi, yes, please. Just picking up on the issue that Jake raised and that's just been raised then about the stigma of asking for help. I think as a local authority, more could be done in that communication. We support a lot of families who can't afford school uniforms, and the message we give to families is very much that it's not your fault that you can't afford it. It's because the school uniform is so disproportionately expensive. And once we get that message across, we see this ripple effect in the community that people will ask for help, and then they will tell their friends and neighbours who are also struggling that there is somewhere they can go for help, and that naturally and it's because we've broken down that stigma and told them very clearly that it's because of external factors. So I think the messaging from the local authority, it would be great to be able to get that message out there that actually if people are struggling, especially during this pandemic, that it's not a personal reflection on anyone's decision making or circumstances. I think it'd be really great for the council to back up that message that lots of the voluntary sector are already peddling in our community.
I think with school uniforms, Emma, it's very important, well, as part of our climate emergency and being greener, that everybody, recycles by passing around their uniforms. And, I've always done that. My kids had things passed on. It wasn't that we couldn't afford to buy them, but why buy them when, somebody can pass it on? And I think developing those groups and everybody just sharing things and presenting it as being a green thing to do, so that removes the stigma of, wearing pre-loved school uniform.
Without a doubt, I totally agree on the school uniform issue. We found that parents who can probably afford brand new school uniform are the ones who are more likely to put their children in second-hand uniform, because there is this stigma attached to, visually, there being visual cues of not being able to afford something. So that's something we've tried to break down with, we run swap shops. So anyone can come and bring their uniform and anyone can come and take anything they need away, which takes away that need for parents to identify themselves as struggling. So I think that message, and certainly the green message, is a way to help people and of course have a huge impact on waste.
Emma, I don't know whether you may even be involved in it, but the Wokingham United Charities runs, part of their organisation runs collecting used uniform and giving it out to local schools' parents who can't afford it.
That's one of our projects. Yeah, that is one of our projects that they funded.
Right.
Yeah.
That's okay then. Just checking.
Yeah.
Okay, Alison, you finished. Finished your question?
Yes, that's all for me. Thank you very much.
Okay. And finally, I've got Jim. Not Jim, Paul.
Thank you, Pauline. Most of my questions have been actually asked already, but somebody said earlier, I think it was Guy, that there's some alarming and disturbing information in this report, and I think it's really good to highlight it. I do have a few questions left. On page 35, second paragraph talks about pre-pandemic employment levels had risen to their highest ever levels, but in work poverty also rose. Is there therefore a link between 0-hour contracts and poverty? My second question was on page 41, referring to the table. You say that at present there does not appear to be a notable impact in the result of the pandemic, but when you compare Q1 and Q2 figures together between the 2 years, there is certainly an upward trend of 18% and 16% increase. And my final point is on school meals. I've received reports that the school meals are not actually a hot lunch. They're more of a packed sandwich type lunch, and some of the quality occasionally is fairly poor. Is there a way that this is being monitored? Thank you.
You can answer that, Laura.
Yeah, I can answer. Let me answer that last question first. So we do monitor our contract with our provider of school meals in the borough. Now that doesn't provide every school, but there are regular surveys and contacts with the schools to monitor that quality. So that does get monitored. It isn't always a cold lunch. During the pandemic, there were that for various operating reasons, there were more cold lunches being offered. A number of schools have moved to hot lunches now, so we're moving back to pre-pandemic, and it was for operating reasons, various kitchens closed, etc. But that's just speaking for our schools where we actually manage that contract with the catering provider.
Just on that, Laura, is it a process of moving school by school then? Because these reports have really come through since the children have gone back since September.
Right. Yeah. So there was a phased introduction of the school meals and the changes. If any feedback that you do get, if you can share it, if you want to share it directly with me in the first instance, that'd be really helpful.
I'll do that. Thank you.
Thank you. So your second point was there's a point around housing numbers that I think Simon will come back on. So Simon, do you want to comment on those housing application numbers?
Before we move on to that, Alison, did you want to come in about the school meals? Do you have a comment on the school meals?
Yes, I was just going to say that was raised at the most recent Children's Services Overview and Scrutiny, Paul.
Oh,
and one of the issues is that currently the children, because they're staying in their bubbles in their classrooms, so they eat at their desks rather than in the hall. There's a health and safety issue about delivering hot meals to the classroom, which obviously, hopefully we can work on, but that was the reason presented to us by Sal.
Yeah, I'm thinking of the poverty issue and, children having, potentially just one hot meal, given to them each day.
Oh, yes, absolutely. I just thought I'd tell you that was the answer.
If it ends up with a cold sandwich type lunch, it's not as inviting, really, for them.
Yeah, well, hopefully we can get a progress update, because now that it's getting colder, it's certainly even more important.
Exactly. Thank you, Alison.
Okay, no, Simon then, sorry to interrupt you.
Hi, Paul. You're talking specifically about the table on page 41, yes?
I was, yes, yeah.
Yeah, so I'm just looking at it now. Yes, we have seen increases in the homeless applications. I would suggest that a number of those are due to the COVID rough sleeping cohort that we've been brought in since March. So we were running at circa 10 guesstimate of rough sleepers prior to COVID. We've actually seen over 50 rough sleepers at one time or another in this phase of the pandemic. I'm pleased to say we've actually found 19 of them settled accommodation. However, we do have circa 30 others that are still in the system. As you may be aware, the council have made a decision that we are to find housing pathways for all this cohort and work with them all to find them settled accommodation in whichever sector is suitable for them. So yes, there has been an increase. I think, could I just touch on the possibility of evictions longer term? Because I know there's a lot of worry amongst members that we are going to see a tsunami come the end of the government rules. I'm working on now that we will probably see the large increase as a result of Section 21s and the end of private sector tenancies. That will come, in my opinion, probably April, May next year. So at this time, yes, we're seeing an increase because of the rough sleeping cohort. As you know, landlords cannot evict anyone in COVID unless they have a very extreme case, and that's the only reason, and that would be for ASB, antisocial behaviour, or high-level rent arrears. So, yes, we've seen that initial spike. I imagine it will stay level for a number of months, but coming into sort of April, May next year, that's when we need to be on our game to make sure we've got a response in place.
Thank you, Simon.
Okay, Paul, thank you. Andy, do you have another question?
There was the other question still.
I beg your pardon. Go carry on then.
Yes. It was the link. It was the link between poverty and zero-hour contracts.
Yeah, so I think those reports provide a lot of detail around why that in-work poverty is increasing, and it is around that insecure employment, and I suppose that's linked to zero-hour contracts and things like that. So it's that insecure and fluctuating income level that can then affect poverty levels for those people.
Okay, thank you.
Okay, cool.
Thank you.
Andy.
Thank you. Thank you, Chair. I can do my questions one at a time to give other people a go. So my question is for Emma Cantrell and for Annette. And one of the purposes of scrutiny, as I said earlier, is to scrutinise the council, including the executive and the officers, to try and improve performance. So my question to you both is, if you could make, what was your, it's two-part really, what was your experience, you've touched on this briefly, what was your experience in terms of how well do you think the council understood what both of your charities did as frontline poverty-facing charities, and secondly, and more importantly, if you could change a couple of things about the way the borough interacts with your charity and your service users, how would that be?
Yes, good questions, Andy. Can I come to Emma first?
Sure. So in terms of how we would like to interact in the future, I think, as I said before, being able to have that dialogue with decision makers and be part of that decision making progress in terms of the anti-poverty and poverty reduction agenda with the local authority is really important. And I think as I said before, I just want to emphasise it's not always about chasing money for charities. It's often about the influence and the doors that can be opened by the local authority in terms of reaching different communities and things. But also I think we've got a lot to offer as small charities on the front line, a lot of insight into a lot of the questions that have been asked this evening, in terms of the type of people we're working with and the issues that are being presented. If we can have that space to be able to feed that back to you in the local authority, I think that could really give some important data for your decision making. Just remind me of the first question again.
I've forgotten it myself. No, the first question was based on your previous experience and perhaps things that the Borough Council wasn't doing as well as it could do. That was the first part, and that's the second part in terms of what improvements would you like to see?
So
I think you've.
Sure. So in terms of the first, pre-pandemic, we really didn't have much interaction, as I say, apart from really with the front line. The community engagement workers are fantastic. Housing and social workers, we've got a lot of frontline contact with, but I would say there hasn't been a collaborative response led by the local authority which takes poverty in the borough seriously. And it is a serious issue. There are thousands of children who are living in relative poverty in this borough. So we would really like to see that taken on as a serious issue.
Thank you, Emma. That's helpful. Annette?
Probably quite similar to Emma, really. I mean, the food bank doesn't provide any kind of commission service or anything like that for the local authority, and our sort of interaction and dialogue historically and pre-COVID was with like some of the different departments at the council. For example, community engagement, we have a very strong relationship with, tenant services, and similar to Emma, we work with a lot of the family workers and social workers, and really I think the local authority used the food bank as kind of a sort of a bit of a means to an end. We've got a family that's on our caseload, they're struggling for food, right, here's a referral, and I think that, I hope that has changed. I hope that there's greater understanding with the local authority with regards to what we do. Moving forward in the future, I think it's quite important when we look at sort of a second wave and sort of food support, that the communication is really out there for residents, so they know who we are and what we do. We tended to find during COVID there was quite a lot of confusion between the distribution hub and the food bank and who went to which one and how people were supported. So I think it's really important to make sure that sort of understanding and communication for the community is really sort of tightened up and is really there. I think we are now in a position where we are in dialogue with some of the people at the council. Martin Sloan is in contact with me on quite a regular basis. How is the food bank? How are you doing? How are you planning? Is there anything you need? And that's all fantastic. But as Emma said, I think we are talking to the people who are struggling with poverty and are unable to put food on the table every day. We have people that come in and they say, and I think they don't realise they've said it out loud, they say things like, "Oh, I'm actually quite hungry," and then they kind of backtrack and realise that they've actually said that to you. So we do hear a lot of these stories, and we do have an understanding of the challenges that some people in Wokingham Borough are facing. So I think it's important for us to have that interaction and dialogue with the council, so we can say, well, these are the things that are happening at the front line. What can we do to try and overcome, what interventions can be put in place for these sorts of things? Because while this report is amazing and there's so much detail in it, but I think organisations like the Food Bank and for First Days, where Emma works, we've got quite a lot of stories to tell, and we can tease out of these numbers where the actual areas are that people need support.
Okay, thank you very much indeed. Was that all, Andy? Do you want to come back?
Jack, let's follow up on that. I mean, I know at the end we're going to make some recommendations. Could I ask, I'm going to be thinking about a recommendation based on how the Borough Council can better improve its performance in terms of its work with the poverty charities, because poverty is going to go up as a result of COVID, so it is within the scope of this exercise. I was just wondering if both Emma and Annette could think about a recommendation they would like to see, and if they can pop me a message or an email. I know Sarah will be thinking about it as well, and perhaps we can tack on a recommendation.
Well, we'll be coming to
a looking ahead type of recommendation.
We'll come to that in a few minutes. That's perfectly acceptable. Annette can put the motion through you, Andy. If she gives you the words, you can propose it. Will that be helpful? Because she's not actually a member of the committee, so she can't make a proposal, but you can do it on her behalf if she gives you the words. Okay. And Sarah, you've still got a question or two?
Yeah, thanks. We've talked a lot about the stats and the data. I just wanted to talk a little bit about going forward, which will tie into recommendations in time. But there's a section in the report that says WBC and partner poverty support. And it states that it's about delivering a number of targeted interventions that address the drivers of poverty and obviously mitigate the effects. Having read a lot of them seem to be very much related to COVID, not some related to pre-COVID, and we mustn't forget that poverty has been an issue long before COVID. But I didn't feel, I'm not an expert in this, I didn't feel that many of them were actually there to address the drivers of poverty. Most of them seem to be more sticking plasters and dealing with the effects of poverty. I wanted to find out from our guests, Emma and Annette, their thoughts on that particular section of the report and some of what's been put forward. Do you actually believe that what is there will address the problem, or does it need to go well beyond that?
Laura?
Well, I wanted to ask Emma and Annette.
Oh yeah,
please.
That's fine. Yes, so Emma first then.
Hi. I do agree with you. Lots of the interventions that are listed are those sticking plaster interventions, which obviously are crucial because we are dealing with people's lives in the moment who need some sort of support. But absolutely, I think we need to go deeper than that. And actually, uniquely to areas like Wokingham, is the issue of inequality. So we find, there's national evidence, academic evidence that is around the idea that children who feel unequal to their peers at school are far more likely to have ill mental health, and they are far more likely to not do as well in their exams, which will then lead on to, life prospects that might keep them in poverty in the future. And obviously all of our aim is to reduce that. So actually in this area, some look and focus on inequality, and for those children who are turning up at school hungry but are sitting down in a classroom next to someone who's just got back from half-term break skiing, that child knows that they are different, and that has a huge effect on children. It's well documented in education circles. So I think actually in an area like Wokingham, we can look at those things, and that can be targeted on a local level to children. That idea of, you know, levelling up, access to services, access to those extracurricular activities for children, all those things that more well-off parents can afford, that children in our community who are in poverty can't. I think those things could actually have a long-term lasting effect for children in a way that isn't just the necessary sticking plaster.
And that's something that can be done at local level in partnership, is it?
Without a doubt. You know, there are so many things. We have families who come to us whose child is desperate to do something as basic as go to Brownies, but they just can't afford the uniform. So we can give them the uniform, and then they can access that whole world of, you know, enrichment for their academic life. You know, similarly, children who can't access sports clubs because they can't afford the subs, or they can't, you know, buy the football boots. We're supporting children with that, and those things have a long-term effect. And actually, for us, in partnership with the local authority, we could give children whose parents can't afford access to really simple things like swimming and all those things, we could really be working harder to make sure that those children who are falling through the gaps are getting access. And the beauty is, it's not an insurmountable number. It's not going to cost a lot.
Thank you.
Annette.
What are your thoughts?
Something that the Trussell Trust, who oversee a lot of the food banks, are talk about a lot is money in people's pockets, basically. And for example, at the moment, people who are on universal credit get an extra £20 a week. And there is a feeling that actually for some people, it has lifted them up just that little bit into a position where they can afford to buy food, because obviously at the food bank, that's sort of where we're coming from. And I was quite interested to hear some of the conversation earlier talking about council tax reduction for care leavers. Now, I understand that there are budgetary constraints in local authorities and in charities and in all sorts of organisations. But really, I think, you know, things like that sound like the sorts of things that a local authority could look at and could address. And things like that can make that little bit of difference to bring households just above that threshold, whereby they are actually able to afford to go to the supermarket and buy what they want to have, rather than come to a food bank and maybe get a lot of pasta and baked beans, which isn't necessarily to their choice. So I think I'd like to see the local authority be in a position where they can look at some of these sort of smaller pockets of things that are picked up, which, you know, will help just lift the money that is in people's pockets, to help them have some dignity about how they spend the money that they have, so they don't have to necessarily always come to somewhere like a food bank for a handout, basically.
Yeah, it's that choice. It's giving people that freedom to choose themselves without being given, and totally get that. Thank you.
So while obviously organisations like First Days and the food bank are here, and we can provide those things for people, I'd love to see a position where we didn't have to be here and we didn't have to provide these services for people in our communities.
Absolutely.
No, I totally agree on
that. Is to close our doors.
Thing before I let someone else ask a question. This would be more sort of internal. I think it might be for Jake, it might be for Simon, I'm not sure. But on some of the things under this list of support, I just want to understand the local housing allowance rates. Now, I'm not an expert in this, but my understanding is that the rates for the area are representative of the rents that a landlord might reasonably be expected to obtain in that area. Is this genuinely the case in Wokingham? And how many residents in Wokingham are finding that the local housing allowance rates are actually enough?
Shall I start there?
Yes, Simon.
Yeah.
Thanks.
Well, I'll let you know, the pre-COVID, the bedroom for a 3-bedroom house, the local housing allowance was 96901, £969 per month. So you go to Zoopla or you go to Martin & Co or any other estate agency, and generally you'll find a 3-bedroom house at between £1,300 and £1,500. So clearly there is a gap. There has been some relaxation in COVID, as you're aware of, but I would say if anyone went to rent a property at local housing allowance for a family in the borough, they generally could not find a home to rent unless they came through a social landlord.
Okay.
So if you're a working household on minimum wage, yeah, you are going to struggle to go over the local housing allowance.
Yeah. And the discretionary housing payment that's there, that's only short term. So is there anything longer term that can help plug that gap between the LHA and reality?
It's the market, I'm afraid, Sarah. Obviously, we can intervene on occasions when people approach us. For example, what we're doing with some of the COVID homeless cohort is we've received funding from government to bridge that gap. So we can place people into settled accommodation and we can assist and bridge the gap. However, that's not a universal offer we have.
Okay.
Okay.
Quite bleak then.
Rochelle.
Okay, this question is for the officers. After listening to all of this so far, what are you going to be doing differently tomorrow or the next day based on all the information that you've been given? And how will you support the charities better? How will you support the residents of Woking better? And what will you do different? I guess I can throw Susan in the mix with this as well.
Are you wanting all of the officers to give you an answer, Rochelle?
I can have summaries from a couple of them, that's fine, but I just want to have an idea of what they've learned from all of this.
Okay, who's going to go first? Simon?
Yeah, well, from my point of view, Rochelle, I've always respected and interacted with the voluntary sector and the charities. That I had conversations with Susan and Jake, and I wanted charities to be at the forefront of the council's thinking when we are delivering services to the vulnerable in the borough. So for me, I will continue my dialogue with the charities as best I can. I will try and find money as required within budgets to help support what they're asking. But ultimately, the communication is the best thing. I can pick up the phone to Emma, Jake, and others within the homelessness forum in the borough. So for me, it's about improving our communication, improving our reach. That's what I would say.
Thank you. Laura, do you have anything to contribute?
Hi, yes. I think as part of a new Directorate of Communities Insight and Change, and this is part of a new remit of my role really, is looking at our strategic approach to poverty. I think certainly the key takeaways for me are the introductions I've had to the voluntary sector, and from what I'm hearing tonight, I think we can work much more closely moving forward to really understand the picture in the borough, and that's going to have some real positive impacts. And I think that also, you know, there's some things that we could do around communications as well. That again forms part of Communities Insight and Change, and so that's, you know, that's a fairly sort of instant way we can support. And so I think that's what I'm hearing, is that if we can support with those communications and really reaching out to our communities, that's something that we could implement fairly easily and quickly, I think.
Sally, any thoughts from you?
I think from my perspective, being able to hear directly from Emma and Jake and others tonight, it starts to make it really real for us to get that direct feedback. And I think because we'd worked quite closely with all of those charities and the voluntary sector piece at the start of COVID-19, I think for me it's been able to make sure that we keep that open dialogue going. So those where we've received their feedback and worked really hard to make sure that that insight was sought, is that we actually make sure that that data is utilised and used to shape our future direction of travel.
Thanks. Susan, would you like to sum up for the officers?
Yes, I can. I would like to make a number of points. So I think for me, I mean, as I said at the start, I'm really committed to partnership working and have been for many years, and I've worked with a whole range of partnerships. What for me has been really crucial tonight is the intelligence and insight side of things that has been talked about, and it's been about the granular sort of like detail and like the qualitative information, if you like, that has been spoken about, that I think that we can make a lot more of and work with the likes of Emma and Jake and the food bank in terms of understanding that real sort of granular detail about the experiences of families and individuals in the borough, and that then can really inform our sort of strategic direction. So it's been mentioned that we don't have an anti-poverty strategy and about the importance of co-production. So I think we have worked in co-production, for example, on the carer strategy, and it's important that we now use and continue to use the great insight and rich insight that we have from the attendees tonight, so that can go into our strategic direction. I think something that Emma said about the fact that fund is not necessarily always about funding, and I think that when we come together, we get really sort of creative, and there are lots of ways of opening and unlocking opportunities that are not necessarily about funding, but ultimately might result in creating some money or saving some funding. So I think for me that was an important point that Emma made, and I think is absolutely spot on as well. And it's about identifying the simple things that will make that difference for families in the borough. And I think it's by coming together and identifying those, what are the 20 things that will make that difference, for example, for families in the borough, those simple things as a starter. So those are the kind of things that I've actually picked up from tonight, just to say thank you very much again.
Thank you very much, all of you. That's super. I've still just got Alison.
One more.
Oh, go on then. Sorry.
Okay. We have 26,000 cases of COVID today. And when and if the numbers go down, will you still continue to do all of these things to help with the poverty in the borough, and not just while we have a pandemic running through the area?
So can I respond? Yeah, I'll respond to that. I think that tonight's really, for me, has been about how we respond to poverty generally. I mean, COVID is an aspect, obviously, because of what's happening in the country right now and what's happening in Wokingham right now. But I see this as something that is fundamental to us going forward, regardless of COVID or not.
Thank you. Now I'm just going to take, Alison's hand's gone down, so I'm just going to take Guy, and then I'm going to move to ask whether anybody's got any recommendations or proposals they want to put forward. And then we'll move on to the last one. Guy?
Chair, my point's just a quick point of order, as it were. And this is maybe something that the officer in charge needs to answer. What time are we actually scheduled to end tonight? Because I'm wondering, do we need to get an extension put in? Because we've spent a very long time talking about this, and there's still several aspects on the agenda to go. I don't want us to run out of time tonight, because this is all very worthy discussion.
Absolutely. Well, I'm assuming that we can go on until 10:30, but we never have been till 10:30, so I'd be very grateful for some guidance from the Chief Executive.
Or even Callum. I honestly can't remember off the top of my head.
No,
I can confirm that's correct, Chairman.
It's 11.
Neil, you've got an answer, have you?
I think it's the usual thing, 10:30. Then if you want to extend further than that, you can.
That's what I thought. That was what I had in mind. But thank you for the clarification. That's really useful. Okay, then. Now, if you want to make a proposal, can you put your hand up and then give us the wording? And Neil, if you could jot that down, please. Andrew and then Andy. Andrew first.
yes, I would like to make a proposal, but I'd like to preface it with just two very, very quick comments. Emma talked passionately about addressing the life-changing inequalities, that many of our residents experience. And the leader of the council, John Halsall, said, quote, "The aim must be to pick up all who are suffering." I could not agree more. Now, my proposal is it's to try and address the definitional problems with the use of the term poverty. And my proposal is that the executive, in view of the multidimensional nature of poverty, in all discussions, in data, policy and action, focus on all who are suffering, different types and rising levels of hardship. So when we talk about poverty, I know it's shorthand, for a lot of different things, but it does run the risk, of missing out a lot of these other really important aspects of the suffering, and significant hardships, that many of our residents face.
I need some concise words then, please, Andy, if you're going to make a proposal.
So can I just read out the proposal out? In view of the multidimensional nature of, inverted commas, poverty, that the council, in all discussions, data, policy and action, focus on all who are suffering, different types of rising and significant hardship.
Thank you. Do you have a seconder? Is somebody willing to second that?
I would.
I'll second that.
Thank you very
much. We have a whole
much.
bunch of them.
I suggest we take each one in turn. I've got the names of Sarah and Rochelle and Andrew who want to propose a motion, but let's take them one at a time. So if those three people could put their hands down for the moment.
No, I'm not proposing one.
And Jim, maybe you could tell us verbally which way you want to vote. So that's the proposal. Can I see those who are in favour of it, if you raise your hands, please? Nobody so far.
7.
Yes, Rochelle.
There are 7 people. 9.
It's the delay in the system.
10.
Sorry?
There are 10 people so far. 11.
Yep, they're coming up. Okay, has everybody voted that wishes to?
12 of them have voted for it.
Right.
13 now.
If you could put your hands down.
That's unanimous.
Is there anybody against? Hands down, please. Can you all put your hands down, please, unless you're voting against this? That's brilliant. Thank you very much. So that's one recommendation passed. Okay, now then I'll go to Andy.
Thank you, Chair. I've got 2 proposals actually. So my first one, I'll do them one at a time, certainly. So my first is in the chat, and the proposal reads that the executive urgently re-examine the issue of 21 to 25-year-old care leavers paying council tax for the rest of this financial year.
You've got a seconder from Sarah Kerr.
Thank you very much. Before we vote on this one, can I just add a word of caution that you bear in mind the fact that Children's Services is already overspending on the things that we have no choice but to do. So anyway, those in favour of Andy's motion? Hands up if you're in agreement. Right, everybody voted that wishes to. Okay, hands down then, and those who are against, put all of your hands down first, please, including yours, Andy, because I presume you want to vote.
Sorry, apologies.
And those against the proposal. Are there any more against? In which case we will move to abstentions.
Oh, Pauline, Guy's just had a technical hitch. Could you just hold on?
Oh yeah, okay, that's fine. Yep. Anybody else wishing to vote against? Right, hands down then, everyone. And there must be some abstentions, so if you're wishing to abstain, could you put your hand up, please? Thank you. Neil, may we have the result, please?
Not sure how Councillor Grandison voted. Chairman, is he back with us?
So who's that?
Councillor Grandison.
No, I'm afraid he's having to restart his PC.
Okay, it was on the votes we've just had. It was 6-4, 4 against, and 2 abstentions.
Thank you very much. So that one goes through. Thank you, Andy. And your second proposal, please.
Guys, you'll be delighted to know that my second proposal is slightly vaguer. And I'm just about to copy it into the chat right now, okay? So give me 2 seconds rather than make everybody read it. So here we go, here we go, here we go. And I've worded it like that, Chair and Neil, because I'm not sure of how the exact relationship between the executive and officers. But we've heard a lot tonight about improved communications between charities and granularity, and it all sounds very good, but I am concerned that there's a lack of formal relationships and formal challenge. Given that the stresses induced by poverty will increase, I would look, and that we've always had a poverty problem and it's not going away, I would like to see stronger links between the charities and the borough, and I would like to the issue of formalisation to be examined. And I mean, the charities have spoken about visibility of what they do. You know, the food bank, I think, has got 1,000 and something followers on Facebook. The borough council's got 12,000. First Days has got, I think, 4,000 or something on Facebook. So it just seems to me that there is an amplification of the poverty-facing charities that could be done, for example, by our social media teams in our borough magazine. So I just want that to be formalised, if you like.
Okay. So do you want it to specifically say for charities that deal with poverty, rather than just charities in general, or all charities?
I think poverty needs to be the priority. So
you might want to add that in.
Let me amend that.
Just to make a comment, there are meetings held weekly with all of the charities, so I don't know what more you think we could do.
This is more about partnership working.
It's a formalisation. I think that the meeting started because of COVID, and they're very much about the COVID response. But I'm looking at the poverty facing side of it, if you like.
Well, could we have some precise words, please, because time is marching on.
I've put a second version up there.
It's in the chat, Pauline.
It's in the chat, Pauline. Sorry.
I will second it, Andy.
Yeah, it's disappeared from mine. So could you verbalise it?
I will read it out. It says, the executive instruct officers to urgently engage with poverty-facing charities to formalise 1, communications, and 2, support offered by WBC to these charities.
Right, is there a seconder?
Yes, Councillor Kerr.
Okay. Those in favour then, please raise your hands.
And again, this isn't a criticism of the work that has been going on already. It's a desire to see stronger links.
Yes, I understand that. Okay, those hands down, and those wanting to vote against. 3 hands, 2 hands still to go down. Can they all go down first, please? Then we'll vote. You all take them down. All take your hands down, please. I haven't asked for the vote yet because there are still some hands up from before. Okay, right, now those who are against, put your hands up.
Pauline, I thought you asked us, it was confusion. You asked everyone to take their hand down who was voting for it.
Yeah, they did, but now we're voting against.
Sorry, I thought that you asked everybody to take their hand down because you wanted to start again on the for vote.
Everybody had not put their hand down, that was why I delayed it. But now if you want to vote against, could you put your hand up again, please?
Sorry, was this for or against?
Against.
Right, thank you.
I didn't think we've taken the vote for. I thought we'd
We have taken the vote for. This is the vote against. Right, so everybody voted that wants to? Okay, hands down, please, as quick as you can. Right, are there any abstentions? Okay, Neil, what's the result, please?
That was 6 for and 6 against.
Right, so somebody didn't vote or abstain. In which case I'll cast the final vote, and that's to be against, because that's where
Andy.
Right, now may I have any of the next proposal, please?
I apologise.
Sarah?
Sorry, I'm still laughing. Sorry. Oh, Andy.
Proposal.
Okay, I have
just
a couple.
the words of the proposal, please, not a speech, because we've had plenty of time for speeches.
Yeah, no, I know. I've got 2 proposals.
Right.
The first one is this committee recommends to the executive that this council will co-produce an anti-poverty strategy.
Okay.
I'll second that.
Seconded. Thank you. Those in favour? Right, and is there anyone against? If you could put your hands down quickly, please. Put your hands down quickly and then we can have the vote against. Having said that, I can't lower my own hand. Right. Oh, it's gone up again.
There's some serious issues going on tonight regarding the responsiveness of the application.
Yes.
Michelle, your hand is still up.
Can you put your hand down, Rochelle?
It's down now.
Lovely. So those against?
I had to get rid of I had to change my headset to speaker so Imogen could hear.
Right, any abstentions? Okay, so I think that one's well carried, Neil. Okay,
Yes, Chairman.
Sarah, your second motion, please.
I tried to put it in chat, but I don't know if that's worked or not. Probably not. I will read it out. This committee recommends to the executive that this council will limit use of comparative data and benchmarking narrative, such as being ranked the least deprived upper tier authority when talking about poverty, except when making specific reference to reduction in poverty. It was this point that I made earlier on in the meeting.
Yeah, what are the actual words of the motion? The whole of it?
Chair, was Andrew, please correct me here, but isn't this somewhat like you said earlier, or am I just going mad?
This is about language.
I thought Andrew's covered that.
I think if I can simplify it, it's
I believe Andrew
Sarah
did cover
wants
that, but
sorry. Go on, Guy.
That was actually Rachel. I was just asking Andrew because I thought his covered that, and I thought I seconded it. I'm sorry. I completely, my laptop decided to completely restart itself.
I know, mine keeps going wonky as well. Sarah, do you mind reading the actual words of the proposal again, please?
Yeah, this committee recommends to the executive that this council will limit use of comparative data and benchmarking narrative, such as being ranked the least deprived upper tier authority, when talking about poverty, except when making specific reference to reduction in poverty. So this is about the point I was making earlier about.
No, I don't want a speech, just the.
Okay. I was just making the point to encourage more people to vote for it.
We should be voting on what you say. Is there a second? Or I'm happy to second that, actually.
Me too, Pauline.
Well, I've got no objection to it at all. It's in regard. I honestly thought Andrew's covered this already.
No, it's a kind of a subset of. It's a subset of what I was proposing.
Yeah, it is a bit.
Fair enough.
Yeah.
Anyway, can we move to the vote, please? Those in favour? Anyone else in favour apart from me?
There's lots of us. You obviously have a delay with hands on your screen, Pauline.
Lovely. Right, hands down then, please, as quickly as you can. There's so many glitches tonight.
My hand was going up and down like it was at a rave. What on earth?
Can I just ask, if you're against, can you just shout out? Okay, then I think that one is carried. Sarah, what's your next one?
No, that's fine. The other things I wanted to bring up are related to forward scrutiny items. So I have some more things, but if we put it under that part of the agenda.
Yeah, we'll do that later. Okay.
Thank you.
Any more proposals from anybody? Shout out because the hands are going haywire. Right. That's super. Thank you very much. So let's move to the last agenda item, which shouldn't take too long because most of it's been covered. But there were just a few questions that I particularly wanted to ask of Meriden. Then I'll see if anybody else wants to ask any either. Meriden, what else can we do as a council for the at-risk groups, particularly the sort of 18 to 30-year-olds and the over 60s? Meriden, are you still there? Lovely.
Yes, I am. Yes, I am here. Yes, hi.
What do we do for those groups? Any ideas?
I think the issue with young people is finding out what their views are. Now, there is a piece of work being done on social marketing on someone we've brought into the Berkshire team to do some of that. So there is some questions and focus groups going on. So it's a bit of finding out why is it that young people feel they don't need to isolate if they're asked to, why they think they should still be out and about with their friends, and what is it that they don't understand. So I think there's something about that. In terms of when you say, if you talk about vulnerable young people, I suppose we're talking about people in the care system, you know, special needs, some of the schools, integrated schools, that kind of thing. I think there's a lot of support already, and actually there's very little evidence that they're overly affected by the pandemic, actually.
Because there's been such a lot of work and a huge amount of support gone into anyone with special needs in our schools, that I think they've not been affected, which is good. I mean, you've already talked about children in poverty and low incomes. You've already talked about those. So I think that, and university students is the other one. I suppose there's something about, I mean, one of the things I put out with care homes, I write to them every week just on what the current rates are, the impact on them, and whether we should consider doing anything about care home visiting. One of the things I added was, as part of their risk assessment, they ought to consider very carefully if they've got any university students that either work in the homes or are visiting. And as part of their risk assessment, they are a high risk group. They're not getting ill, but if they're in contact with older people, or if they're in contact with people who've got diabetes or the usual risk categories, then they're putting other people at risk. And a lot of them don't have very mild symptoms. Now, it's not that we want to exclude university students from anything, but it's just part of the risk assessment. You might want to make sure that anyone who's a university student is not within 2 meters of anyone who's a highly vulnerable person. So those are the groups.
Would it be useful if we had that as a recommendation, that we advise care homes, if they have any young people working for them, to make sure that they socially distance?
Yes.
Because if so, I'm very happy to propose that, if somebody's willing to second it. Is anybody willing to second that?
I'll second it for you, Pauline.
Okay, thank you.
Hobbs.
Thank you. I'm giving up on the hand, so could you shout out your name if you're against that?
Pauline, could you just repeat what it is you're asking for again, please?
Right, that we advise the care homes, if they have any young people working for them, to make sure that they socially distance from the older people. Okay. But if there's nobody against, sorry, Maridin. If there's nobody shouting out that they're against.
Sorry, Pauline.
Sorry, Jim.
If you've got young people working in a care home,
yes,
I'm not sure how they can perform their duties and socially distance.
If they have any young people working in a care home, we would advise them to ensure that they socially distance.
Outside of work.
Well, it's difficult for them to monitor that, isn't it? I was really thinking of inside the care home.
Maybe we could suggest that they have a test.
Yes, would that be feasible?
They can incorporate as part of their risk assessment, because they're supposed to do a risk assessment for every member of staff.
Yeah.
So, for example, if part of your risk assessment would be they wouldn't bring in someone to work in the home if they work somewhere else. So it could be just part of the questions. To expand their risk assessment to incorporate university students and young people.
That seems more reasonable, Meredith.
Yeah.
Okay.
I'm very happy with that wording then. Is the seconder happy to have that change? Emma?
Yep, that's fine.
Okay. Can I take that as having been agreed unanimously then, unless anybody's got an objection? Okay, thank you. Are there any other questions to Meriden?
There was just one other point about young people, and that's about events.
Oh, yes.
Any event that involves young people, it would be very hard to enforce. And whether we should be allowing any events to go ahead between now and Christmas or next year. It's a question. It's a question back.
Yeah, okay. I don't know how we would check that. Andrew?
Yeah. And could I ask for a point of clarification? Would that include sporting events, matches?
I think there's clear guidance on sporting events. There's already clear guidance on sporting events going ahead and which sporting clubs can operate. So no, I don't think it would include sporting events. It would include if there's additional ones.
Yeah.
Madam Chairman, I think you're sorry to interrupt you, but I think you'll find there's a lot of things that have already been cancelled from what I can tell.
I think that's rather a complex situation for us to make a proposal about.
Yeah,
is Remembrance Sunday also going to be cancelled because of that? Remembering all of our dead from the wars.
So sorry, Rochelle, so can you repeat that?
Is Remembrance Sunday also going to be cancelled and cancelling all events?
Yeah.
Remember,
everybody who all the veterans and all the people who died keeping our country.
I believe church services are by invitation only, so
yes,
there will be limited representatives.
This is too complex for us to actually deal with at the moment. So
yes.
If we can move on. Are there any other questions to Meriden?
Chair, sorry, it's not a question to Meriden as such, but it's a question about Appendix A on care homes, which is provided as part of the report. And I noticed that report doesn't seem to have any recommendations coming out of it.
No, that's our job, I think, to make some.
No, what I'm saying is that we were provided with notes from that meeting. So I'm looking at the notes, and so as we're the top level scrutiny committee, I guess it's a good time to remind people that we are here to scrutinise and to make recommendations, and where we're having meetings and no recommendations are coming out of those meetings, it seems to me that members aren't doing their job properly.
Well, I think
that's a comment. I mean, it's too late, that report's been written, but it's a comment. That's all.
Guy, do you want to comment on that?
I presume this was in, you said, was it Appendix A in regards to the care homes, Andy? Because I'm looking at it and I'm going Appendix 1 and my brain didn't want to put two and two together.
My mistake, it was Appendix 1.
If I remember correctly from that meeting, the feedback from the committee was that the process that the council had done in that regard was there really wasn't that much room for improvement. So no formal recommendation came from the committee in that regard, because the information and the data that was presented to us gave a very clear picture that in regards to the care homes, that the process had been followed was probably as good as we could have done it at the time. In regards to the, and I seem to recall that it was, I think it was Councillor Jones who was praising the executive in regards to the decision not to admit people from hospital without the COVID tests. Neil, is there anything further you can add on that as well?
Thanks, Guy. I think if members cast their mind back to June, the original idea was for the different scrutiny committees to carry out pieces of work on this and then bring it all back together into a report with recommendations for the executive. So we're getting,
that was my understanding as well. So let's move then to the recommendations under this item. We have considered 1 and 2, so I don't think we need to do any more about that. The key issues for the report. One thing I would like to include, and that is that quite a number of councillors have asked if we could have an organogram of officers down to, say, the 3rd tier to know exactly what they're doing at the moment, because their job roles may have changed in terms of in terms of what they're doing because of COVID. So could I ask if we could have an organogram, please? Would that be okay, Neil? Do you think you could kindly organise that?
Yes, Chairman.
Thank you. And then the main bit of the recommendations are essentially the proposals that we've passed this evening.
Chair, could I add a couple of others?
Well, we have been through this, Andy, but if they're quick.
Yes. The first one, the importance of supporting all aspects of WBC staff welfare as we go into the second wave of COVID, because I think that a lot of the council staff have been under a lot of stress and will need a lot of support and help.
Sure. Then I think I'm trying to think how to word that, just to start it off by saying we are resolved to. Would anybody have a problem with that? I'm happy to second that. Okay, then we'll add that then. Was there another one, Andy?
Yes,
Andy?
please. Yep. Review and probably strengthen compliance with COVID restrictions, especially in workplaces and public places. Although I do take on board what Meriden said earlier about there haven't been any significant outbreaks in workplaces, but certainly some of the feedback I'm getting from residents is concerns over compliance and enforcement.
I'm not sure that that's something that the executive can control, actually.
Okay.
Okay.
And then a third one, if I may. Okay.
Right.
Could we note that references to domestic violence and abuse are noticeably sparse in all of the documentation and require explicit recognition and actions?
That makes sense. Is there a seconder for that?
I'll second that.
Okay. Is there anyone that would be against that? Shout out. So presumably everybody's happy to be in favour of that. Okay, we'll add that one in then.
Thank you.
Right. And then moving on to the letter from me. I'll read out what I think I would like to send because I have already sent one to thank the staff, but of course things have moved on somewhat. So this is what I would like to say. If you're happy with this, the Overview and Scrutiny Management Committee has asked me to write to you again to thank you. This is to Susan, to thank you and all of the council staff, given that we are in a new and ever-changing situation with regard to COVID, and this I am more than happy to do. We not only appreciate your hard work throughout in responding to this crisis, but realise that you are being incredibly flexible in being asked to do different things and take on new roles. We understand the challenges in this, as well as your own personal concern for your family and friends while you have to work on these challenges. Thank you all again, therefore, for continuing to do this as you focus on the future. All your councillors want you to know of our ongoing acknowledgement and appreciation of all that you are doing. And if I send it to Susan, if she could send that message to all of the staff. Is everybody happy with that wording? Anybody that doesn't like it?
That's fine.
Okay, thank you. So that is what I will ask Neil if he could write to Susan then, and asking her to pass that message on to the staff. Okay, then can I just see whether there is anybody against those 4 recommendations as part of the recommendations? Andy.
Chair, I'm not against, Chair, obviously, but I am a little bit uncomfortable that we've excluded a very, very important group, and I appreciate that this is about the borough's response, but if we look at the borough's response in the wider sense and we move away from the borough council and we move away from the charitable institutions, we haven't mentioned the sort of extraordinary response of the people, of lots of residents who did a lot of donkey work. You know, the people who queued up at the pharmacies, the people who packed the food parcels, the people who were in all the street groups. There was a group in Whitegates, for example. There was a very big group in Woodley. There were probably other of these community groups all around the borough, and they don't seem to have any visibility.
I don't disagree with your concept, Andy, but the letter is really just the staff.
Yeah.
And the problem with sending it to other groups is who do you leave out? And what if you leave out the wrong group?
I don't think one has to name all of the groups, because, as you say, that would be individuals to the groups who you did leave out. But perhaps a mention or a line in there, perhaps Neil could craft something. There was a big community effort. The Borough Council was part of a big community effort that involved hundreds, perhaps even thousands of volunteers who all did their bit.
Just a sentence then.
I agree with that.
Something along the line. I get where Andy's coming from. Something along the lines of effectively thanking our community. It can be as simple as that. Is where I think Andy's coming from. It's effectively
the letter is to Susan.
One at a time, please. Is that okay, Andy?
I think my point is we need to acknowledge the community contribution. We're not thanking Susan for that, obviously, but we need to make clear that there was a big community contribution.
If it wasn't for the community volunteers, we wouldn't have seen what we saw.
I think of it as like a Christmas tree, that the council provided like the trunk and perhaps the branches, but all of the decorations and all the tinsel were all of the people running around in their communities doing the work.
At the end, then, after. I want you to know of our ongoing acknowledgement and appreciation of all you are doing alongside all of the voluntary organisations.
All of the volunteers rather than organisations and volunteers. Volunteers is the key word, yeah.
Yeah, and I won't mention Christmas. It's still only October. Thank you.
It's my favourite image.
It's already out in the shops.
Not interested.
Boris Johnson is cancelling Christmas. Haven't you heard?
Yes, exactly. Right then, can I see whether anybody is against that whole recommendation? Okay, thank you. So that's passed. Now, the last couple of items on the
Chair.
agenda. Yes,
Chair, just for formality, considering I noticed the time, can I move that we extend the meeting past 10:30 to 11 o'clock?
Yep.
We need to
go till
cover
11.
everything on this.
Yes, I'm happy to second that. Anyone against? Right. I think we should be more or less finished by 10:30 anyway, but it's belt and braces thing. Okay, well, the next item on the agenda is to look at the forward programme for the executive. Just one thing, Neil. Should the November meeting contain a report from our meeting tonight? I notice it's not there, but they will be looking at our report, won't they?
I think it might be sensible to bring a draft report to the next meeting of the committee in November.
Okay.
And then members can agree the content, then send it on to the January executive.
Right. No, that makes a lot of sense. Thanks for that suggestion, Neil. In which case, could you put it on our November meeting agenda? Because I know we're having an update on every agenda, aren't we? On our response to COVID.
Yes, Chairman.
Is that right? So we'll find that on every one of our agenda items, an update on our response to COVID, and if we can add as an extra agenda item to review the draft to go to executive. Is it okay?
Yes, Chairman.
Right. Okay. Any more comments on the executive forward programme or the individual executive member decisions? Lovely. Then we'll move to the overview and scrutiny committee's forward programmes, including our own, which will contain an update on progress on COVID each time. And as I've just said, in November we will look at our draft report for the executive. Anything anybody else think should go on to our agenda?
Hi, not sure if you can see my hand. There were some things coming out of the poverty report that I wanted to be continue to be brought back. One of them I think is potentially for children's. So, I mean, obviously, I'll just put this out there, and it's obviously up to children's services whether they take it or not. Shall I come to that when we get to children's and just focus on the ones for management now?
Neil, a comment on that?
Well, I'm just asking you about order of business right now, Pauline. So,
The order of business.
I'll go through the others and I'll come to children's in a minute. So I guess what I was hoping for is at some point, now that we've passed, well, hopefully, if the executive agree to go ahead with a co-production of an anti-poverty strategy, I'd like to then see that come to this committee so that we can be involved through the open scrutiny process and have inputs into that, please.
Right. That would take a little bit of time to develop, but I might suggest...
I just want to get that on the future forward programme so it's there ready for the future so it doesn't get forgotten about.
I don't think it'll get forgotten about. Perhaps we could put it on the January agenda. That would give time for them to develop one if they're of a mind to do so. That'd be time
I just want
enough,
to make sure we get it at the overview stage as well so we don't get it once it's almost finished.
Yeah, well, we don't have a meeting in December, and I think in practice they couldn't get it done by November anyway.
Can I suggest that I talk to the officers about a suitable time frame, Chairman?
Yeah, that would be good, Neil.
I'm happy with that, Neil.
Yep. I mean, Sarah's right. We don't want it to be forgotten. It may well be that the executive decides not to do it, but if they do, then yes, Neil, if you could devise a time for it to come back to us. I know you won't forget, and we can have that minuted. Okay.
One of the other things we've talked about tonight is obviously the necessity for partnership working in tackling poverty. And I'd like to see a report come back about how the council plans to effectively work with and support charities and partners specifically on poverty. And I'd like to see how we're progressing in that regard.
Would that not come into the strategy?
Potentially. We don't even know if they're going to pass it, but potentially. But the strategy is going to take a little while, and I think this is something that needs to be addressed a lot sooner.
What does anybody else think?
I'm looking at something shorter term, and then the strategy will be the longer term solution to the problem.
Any comments on that? And personally, I think if it comes into the strategy, that would do it. And we do have quite big agendas, don't we? I personally don't think we should put it in at the moment. Let's see what happens with the strategy. If if the executive decides not to make one, then we can return to it. You can bring it up at next meeting.
I think bring it up in the 25th of November meeting.
Yeah.
That's a month's time. We'll have a bit more information, I think, by then, and then we can chuck it in January or February. It's worthwhile doing.
Certainly.
But right now I think we need to ask the question again in November and then move it in January or February if required. Is my gut feeling.
We'll raise it again. We know what's going on with the exec. There was one other thing, which is I think it's more children's services, but it's something that's been raised tonight.
We must be careful not to prejudge what the executive will decide to do. So
I just want to make sure that this stays on the agenda.
Okay, let's move on to children's services then, Sarah.
Okay, Alison, I wanted to suggest, based on what Emma from First Days was saying about the effects of inequality on children specifically. So we talked a lot about the stats, but not the actual effects that those inequalities have on children and the measures to address this. I was wondering if it would make sense for children's services to dig a little deeper into that.
Your view, Alison?
Well, as you know, Sarah, all children receiving free school meals get pupil premium. Well, sorry, the school receives pupil premium for them to employ that however each school sees fit to try and remove any inequalities and try and help the children come up. So are you talking about perhaps we should specifically look at pupil premium and how that's used across the borough?
That could be an avenue to look at, not necessarily the only avenue. The problem you have is children that qualify for free school meals, it's based on certain benefits. And so there are children that fall through the gaps who are still hungry but don't qualify. You've obviously got the universal rollout of free school meals for infant school children, but as soon as you go into junior school, you don't. And the problem you have there then is you've got children who are on free school meals and children who aren't, and it's almost segregation in a way. So these children over here know and these don't, and it's the impact it has on those children and that inequality.
There won't be any data available then on the children that you're highlighting because they're not an identified cohort, as the pupil premium, as the FSA, as the BAME children, when schools are looking at the achievement of all their different target groups, the children that you're talking about who might be from a low-income family but don't qualify for free school meals, they're not identified by the school, are they?
So
I'm talking. So I'm talking, I mean, that is a line of inquiry, but I'm talking more generally about the inequalities that poverty has on children and the longer term effects, and specifically how we look at children. I mean, the data around that.
Obviously,
I mean,
the ONS can only look at what the council's doing, what the council could do. We can't be discussing and exploring that as an issue. So we need to be defining it as what we're looking at that the borough are doing or not doing, and what we can do.
So, Laura, is there data available on that, please?
I think I'd be guided by Alison, as she's the chairman of the committee. But I'm happy to take a vote on it. Sorry?
If it's a data issue, then is Laura still here? Then if
no,
it's a data...
I'm not seeing her on the attendee list at the moment, unless I'm
Okay,
blind.
I'll raise it and find out what data we actually have on this, because I think it's something that is really important.
Alison, guide us, please, as to whether we should put this on your agenda or not. Yes or no?
Well, we've got very, very full agenda in November and January, so it would be in February or March. I think, Sarah, what's probably best if I bring this when we discuss the forward programme on November the 5th for children's services, and the committee there can decide whether it's something we can.
Yeah, that sounds a good compromise. Is that okay, Sarah? Then
I'm happy for the committee to discuss and decide.
It's up to the Children's Services Committee whether they want to pick it up, I think.
May I also perhaps suggest that before that meeting in November, I think the 25th, you said, Alison, would it be possible for you to have a discussion with officers?
It's on the 5th, Andrew.
The 5th, okay, to see what just what data is available, but also more equally importantly, what sort of levers the council has, to address these issues of inequality. I think it'd be really useful to have some officer input before that meeting.
Certainly, I'll talk to Gillian Cole.
Yeah, that's a good idea. Then when it comes up for discussion at your meeting, you'll have some evidence to put forward. Thank you.
Gillian will be at the meeting, so we'll be able to help us.
Great, thank you. I'm not dismissing what you're saying, Sarah. I'm just thinking of the practicalities of what we can do and the timing for it all, and the consciousness that Children's Services does deal with an awful lot of stuff. Okay, thank you very much for that. There's something under the HOSC one that I wanted to raise right at the end, under unscheduled topics. It says ambulance response times, self-harm related hospital admissions in 15 to 19-year-olds, and suicide prevention. Neil, are they going to go on to any agenda at any point?
Well, yes, they will at some point. I don't know if Ken's still on the call.
I certainly am.
Ken, have you got any thoughts as to when you could pick them up?
Yeah, I looked at all three of those items, and I think the ambulance one someone had already requested, and also I'm very keen to get the self-harm one and the suicide prevention looked at. The only time we can fit that in will be the January meeting, which at the moment has got the space to do it. On the November meeting on the 18th, we've had the CCG say they will attend, and they're going to be discussing the hydropool, which was a little bit sensitive the last time we discussed it. I think they were trying to move it to about 20 miles away or something. So that created havoc. So that'll be interesting to see what they say there. We've also got the dentistry people still to come in. They haven't answered. They haven't got back to Madeline at all, so we don't really know where that's at the moment. But that's not going to vanish, and that will probably appear in January as well.
Okay. Well, maybe you could liaise with Neil then and fix a meeting to put those three things onto one or other of the agenda.
Always.
Yep, lovely. Thank you. Guy, any comment on your one?
You mean Mr. Extraordinary Ready Meeting? Yes, there is one comment. The adult shared services item has been pushed back due to the fact that staff are in the process of being redeployed due to the potential C-19 issue. The rest of the process is effectively on the 28th of October, or being well, I will be there. To basically have the revenue bids for children's and adult services. Then going on to the 23rd of November, which I should be there. The reason why I say that is due to imminent arrival of daughter number 2 at some point in the next 3 or 4 weeks. Which is basically looking at the non-care related directories, so corporate services, etc. And then finally we go into December, which I'm certain officers and councillors absolutely love me for the 22nd of December, where we're looking at the capital programme and special line items, and then potentially looking into, and then going into January for the final budget process. The first meeting has gone off really well. It is a real challenge that we've got this year with the budget, and it was well received so far. Some comments have already been made on how to improve the process for the next few meetings, but other than that, that's fine. I suspect there will be some additional items from the work program put on as spare capacity, but if my memory is correct, the audit shared service is due to be shuffled back only a month as things stand, unless things get worse. That's it from me.
Pauline, have you frozen?
I think Pauline has frozen.
How much worse than 26,000 new cases?
I think we need a 50p for the meter. I'm not sure what's going on.
Oh, God, Lord.
Alison, do you want to take over?
Yeah, I think Alison needs to take over for the last 5 minutes.
Yeah.
Okay, so we've gone through the 3 subcommittees now, haven't we?
Yeah, just got to close the meeting.
Right. Okay. Well.
But before we close, Alison, can I just have one thing, please?
Go ahead, Jim.
Yeah. Right at the start of the meeting, Sarah quite rightly asked about the travellers update from the previous minutes, and it was mentioned that the website had been updated. During tonight's meeting, I've tried to find that information. I can't find it anywhere. I would just like it kept somewhere near, if we can, just to remind us that we need to see that through to fulfilment. It's definitely not there at this moment in time, not that I can find.
Okay, I'll trace it, Jim.
Thank you very much. Thanks, Alison.
Thanks, Jim. Right, thank you all very much. I think that was an excellent meeting, and I'll see you all next time. And I'll pass on your love to Pauline. Good night.
Thanks, everyone.
Good night, everyone.
Good night,
Alison.